implementing the program of action. So in 2024, here we are celebrating or marking the 1994 Cairo conference. Just an overview of ICPD, then I give significance of ICPD program of action, the Nairobi Summit on ICPD 25, then just highlights of the implementation of the Kenya country commitments. And I look at not just from 2019, but I stretch a little bit behind before 2019 to around from 1994. Then we look at the challenges, some of the challenges, and then make some recommendations. Of course, ICPDs are a series of global conferences that have been very important in shaping the global population agenda. So they have been taking place at least 10 years apart, with the first one having been in 1974 in the Bucharest, Romania. This is where it focused on whether rapid population growth was a major issue that was affecting economic development. And then here some of the countries advocated for strong family planning programs. Others emphasized on development as a primary means to address population issues. 10 years later, in 1984, we had the Mexico City ICPD. Here there was still renewed emphasis on fertility control and family planning. And therefore, there was no much issues that came out in terms of linkages between population and broader issues of health and education. Fast forward, 1994, which has always been on our minds. They call it the landmark conference. Here we made a paradigm shift from focusing on numbers and fertility control, and therefore we put the humans into the center of development. And for the very first time, policies were recognized, population policies were recognized as fundamentally intertwined with issues of individual human rights and sustainable development. As indicated earlier by colleagues who have spoken before me, quite a number of countries, 175 governments were represented, including stakeholders from even the private sector. So here we adopted the ICPD program of action, which was supposed to be implemented up to 2014. And therefore, this program of action moved population policy and programs away from focus on numbers, as earlier indicated. Therefore, emphasis was put on the improving the lives of individuals and increasing the respect of their human rights. So we've been doing reviews, and 1999 we did our first review. After the Cairo conference, we saw some advances which had been made, especially in family planning, but there was gaps in funding and implementation of the program of action. Then the second review, which took place in 2004, this marked 10 years since the conference. And here discussions really centered on integrating reproductive health in the MDGs by then. So, and the progress had been made, particularly in reducing child mortality, but there was a long way to go, especially in reaching the poorest and most vulnerable populations. We made another review in 2009, that is ICPD at 15. The focus here remained on achieving the goals of the program of action. And although progress had been made in some areas, we had a lot of regional disparities, especially in the Sub-Saharan Africa and the Asian regions. And therefore, there was a renewed call for greater investment in various issues, RH, education, gender equality, and also part of efforts to meet the Millennium Development Goals. And therefore, after that review in 2011, there was a decision that we were to extend the implementation of the program of action beyond 2014. And here, 20 years after the ICPD, in 2014, there was a mixed progress, and there was significant advances in some regions, but persistent challenges in some indicators like maternal health, adolescent reproductive health, gender-based violence. And here then there was the issue of integrating ICPD goals with the newly adopted SDGs after the expiry of the MDGs. And so even as a country, before moving ahead, even as a country and even as a region in Africa, it is now where we started reviewing when we came up with what we call the Addis Ababa Declaration in 2013, as was earlier mentioned by my colleague. And therefore, we've been reviewing the Addis Ababa Declaration commitments that also include ICPD commitments. So the 8.8 Addis Ababa Declaration. So we've done the 5th review. We've gone to the right now to the 10th review that we did in 2014. Creating financing momentum, demographic diversity, and sustainable development. I think this has been mentioned by my colleague in detail. I wouldn't go directly to some of the milestones. I want to indicate from the beginning that we made quite a lot of progress in the country, especially at national level, in all the 17 commitments. And therefore, you can see even from commitment 1, ensuring young people attain highest possible standard of health, where you can see the progress we've made in terms of morbidity and mortality. And therefore, we've seen some of the contributing factors, especially with regard to having our mothers deliver using skill delivery. And therefore, we've seen this increase from 62 in 2014 to 89 in 2022. And you can see with regard to maternal mortality ratio, whereby we are still losing our mothers, 355 per 100,000 live births. And also we are still losing our children, based on those indicators. Commitment number 3, in terms of increasing health sector financing to 15% of the total budget, as per the Abuja Declaration by 2030. And you can see in this figure, this is the share of total national government expenditure on health to total national government expenditure. That is 2018-2019 to 2023-2024 financial year. It has been gradually increasing. We are now at 4.5 in 2023. These are according to the Economic Survey report. And since health has been devolved, here we can see the share of county government's expenditure on health to total county government expenditure, which is gradually reducing. I think that there is need to understand why the reduction. Of course, you will hear that much of the funds that goes to the counties goes to take care of the health sector, and this is according to the report, the Economic Survey report of 2024. Commitment number 4 was to improve the social protection for older persons and the orphans and vulnerable children by increasing the core social protection investment. We have a full-fledged State Department for Social Protection that was established in 2013 to just deal with these issues of social protection. And therefore, one of the biggest projects is the National Safety Net Program that we usually call the Inua Jamii. And here the focus is on especially when you look at the older persons cash transfer, and therefore which we are targeting all older persons 70 years and above. We are yet to cover all the older persons, and we are at 92%. In terms of person with disability, we are at 11%. Coverage of OVCs, that's all orphans and vulnerable children, we are at 10%. We've been able to enhance integration of population health and development programs through integration into the medium-term plans 1 to 4, and also through the PhD strategic plans, and we are happy that we are already developing the second strategic plan for PhD that is supposed to be aligned with the implementation of the medium term from 2020 to 2027, 2028 financially. A lot has happened also in terms of statistics and providing quality data, and started with the amendment of the 2006 Statistics Act in 2019 just to strengthen the lead role of the Kenya National Bureau of Statistics in production and dissemination of statistical information. So far from 1994, we've been able to hold successfully 3 censuses, which is not very easy. Many countries are not able to do that. And we have also come up with a very innovative approach in terms of having a framework for citizen genetic data, whereby other partners who generate data are able to be brought on the national statistical system after undergoing some standards and checks. And a good example is the performance monitoring for action, the PMA, which is now official statistics that is data that is generated by the International Center for Reproductive Health. And then we have also put in place various data protection modalities, the Commission of Data Protection in Kenya, which is also a good thing, and it relates very well to what is happening even in terms of data protection at digital level. The policies, we've been able to come up with quite a number of policies, from 1967 family planning program up to the current and the recently launched session of paper number 1 of 2023 on the Kenya National Population Policy for Sustainable Development. And I believe that members will be able to have a copy of this policy. It's an overarching policy that addresses quite a number of issues, including integrating population issues into a policy framework. DD, we've been able to, having revised our first DD from 2017, 2018, 2020, now we have a new DD roadmap, which we are implementing. Three reports have already been developed. We are on the third report. And therefore, quite a number of things have happened in terms of harnessing the DD of our young persons, looking at what is happening even in the government with a lot of support and emphasis from the bottom-up economic transformation agenda, and having brought even the young persons being able to access government procurement opportunities through what we call the AGPO. And we have also enacted the National Employment Authority that helps us in coordinating issues of employment in the country. Eliminating legal policy, programmatic barriers that impede youth participation. Quite a number of things have happened in terms of affirmative action, ensuring that young persons are represented in the political spheres. You've seen nominations happening, especially for the young persons, both at national assembly and even the county assemblies. And therefore, this figure shows the participation of our young persons in 2017 and 2022 general elections. I think interestingly is the need to just look at what will happen in the 2027 election. So we are seeing the number of young persons participating in these elective positions increasing from one elective period to the other. We've also seen in terms of attaining universal education and attaining 100% transition, looking at the figures, that is a 2022 78.6, that is primary to secondary transition rates. Of course, various reasons. There is the issue of free-day secondary education. Infrastructure has been enhanced in public schools. We are also supporting what we call special needs education in primary schools to acquire special learning resources. Programs such as the feeding program that are meant to retain our learners into schools, sanitary towels program, which is also supposed to retain our girls in school due to the natural events. And so one of the things that we are also emphasizing is trying to improve the employability of our young persons, especially through promoting TVET education And we've seen an increase in number of TVET institutions. Looking at this figure, you will see the trends in enrollment having rose from 430,000 in 2019, and here in 2022 we are at around 562, which is a good increase. So there is an increase in engaging in more young persons joining the TVET, especially with regard to after there are a lot of advocacy and promotion and awareness.
Ken, 5
Sorry?
more minutes. 5 more minutes.
Okay. I'm almost. So as we are also supposed to ensure that we have 100% implementation of the CBC by 2022, which we have already surpassed. So at this point, we are rollout of CBC is at up to grade 8. A lot has happened in terms of curriculum support materials, capacity building of the trainers, and ending of FGM. You can see from the figure, a lot has happened as well. That has contributed to us celebrating this progress, 38, from 38 in 1998 to 15 by 2022. GBV still with us as we talk about around 34% of women have experienced physical violence. And you can also see men have experienced sexual violence. So we still have issues a lot of gaps to address. We have at least we have an institution. We have institutionalized issues to do with to address gender discrimination and other forms of discrimination through the National Gender and Equality Commission, including addressing the issue of representation of women into parliament. And you can see some of the figures at national level and even at county level. Issues of humanitarian fragile contexts. A lot has happened. Minimum standards for prevention and response to gender-based violence in emergencies have been put in place. And there is responses even when it happens in terms of distribution of life-saving RH commodities, especially supported by the UNFPA and other partners. So, and we, as commitment number 17 in terms of tracking, we've been able to track together with the UNFPA, which tracks at global level, but at country level we are tracking, NCPD's tracking, implementation of the ICPD program of action through the Nairobi Summit commitments, and we've been able to develop 4 reports, the 5th report's underway. Quite a number of challenges. COVID-19 is one of the main challenges that was about to erode the gains that we made. And there is a persisting sociocultural barriers towards addressing various population concerns, which have been with us. Of course, limited resources towards implementing this. So there's need to fast track the NCPD bill that will give NCPD a more powerful legal framework that will be able to coordinate well all the population programs, and the need to revamp the national integrated monitoring and evaluation system and the county integrated monitoring and evaluation systems for us to be able to report and generate our information online. Then enforce and implement existing legislative frameworks, for instance, the Children Act and various gender-related policies. Of course, of importance is to enhance domestic financing of the various population programs and regular coordination of reporting forums for tracking ICPD 25 commitments and the program of action. That is the end of my presentation, and thank you.
Thank you very much, Ken, for that very elaborate presentation. While you're online, you'll hear our thunder. So thank you very much, Ken, for giving us an interlude of what is happening behind the scenes. And like you have rightly confirmed that NCPD is still on track when it comes to the mandate it was given back in 2019 of tracking, monitoring, tracking, and reporting on the progress of the ICPD 25. I don't know whether there is one with a burning question. And just as I may say, like what Ken had alluded to, is that the progress, the way it is done, all the stakeholders within and without, that is state and non-state actors, they report on ICPD. And so there is a technical working group committee where Dr. Yagon is a member. She comes to report there on commitment number what, Yagon? Yes, she's responsible for commitment number 8 and 9 when it comes to young people, and other people seated here are also members of that. And this year we were supported to get the CSO contribution on ICPD 25. So at least this 5th year report that we hope to launch before the end of this calendar year will be also be having the contribution of the CSOs, because they also do a lot in complementing what the government is doing as far as the 16 commitments are concerned. So if we do not have a burning one, can kindly still stick online. We need to go to the digital matters so that we can start feeling the heat of the meeting today. And Erastus, karibu sana. We want to showcase number 1. We are going up to 6 showcases. We want to see those beautiful tomatoes that we saw you eating there. So karibu.
Thank you. My name is Erastus, as I said, CPD. And I'm going to take you through the in-government services in Kenya. I'll just give a snapshot. We cannot actually exhaustively look at all the in-government services that we have in Kenya. In fact, we have more than 16,000 in-government services that have already been onboarded on the eCitizen platform. So I'll just give an highlight of what has been done so far. Next. So you will find that in a landmark development that promised to transform the landscape for the public service delivery, the Kenyan government launched an eCitizen portal, making a number of government services readily accessible to its citizens. That's why I'm saying now, currently looking at the eCitizen portal, we have more than 16,000 services that are already onboarded. And I think the exercise is not over, it's also ongoing. And the government has directed the ministries, the state departments, the county governments to ensure that they digitalize their processes and operations, and they onboard them to this particular platform. Next. So the former CS, that's Susan, commented on the milestone of onboarding these services into the portal, and he emphasized on the issue of leveraging the eCitizen portal, whereby we are saying that all the services have been unified. All the services have been put in one basket, making them readily available and accessible. So the portal hosts a wide range of programs and services in the health sector, including, for example, the National Health Record, the Electronic Claims Management System, Point of Care System for inpatients and outpatients, the monitoring of drug dispensing, digital kiosks, vigilance systems, and many others. So like when you look at the digital kiosks, I think you have been to banks and you have that digital operator there, whereby you usually key in exactly what you need to do. Or, for example, the teller that you want to get for services. So most of organizations have made a stride towards automating their services and their operations or processes. Next. Now, also you'll find that the principal secretary state department also highlighted some impacts that are going to be realized in healthcare sector through the digitalization of their processes. And we are talking about being able to monitor the performance, ensuring that Kenyans have full maybe control of their records, meaning that you can be able to log into their portal, maybe provide maybe get some information about your health records, etc. Also facilitating the seamless collaboration between healthcare providers and citizens. So those are some of the highlights that the PS gave then. Then we're saying that digitization of government services on e-citizen portal marks a monumental shift towards efficient service delivery and transparency to citizens. Remember, this is just a process. We are talking about for you to be in a position to put these particular services onto the platform. The first thing that you need to do as an organization first is to identify those particular maybe what we call the customer facing services, and then you put them into a form that is digitizing. Put them in a form that now can be placed on this particular platform. So there are two aspects here of digitizing and digitalization, where digitalization now is converting or integrating now digital technologies into business operations. Next. Now, I will also need to quote what the PS Health and Professional Standards said. She said that we believe that digitizing government services through e-citizen portal, we are ushering in a new era of efficient and transparent public service delivery. This transformative move will not only enhance convenience for citizens, but also strengthen our commitment to professionalism and high standards of a public sector. So we know that with digital technologies, it is very easy to weed out issues of corruption. It is also easy to ensure that we offer efficient services to citizens. Next. Now, I've just picked a number of services that have already been onboarded onto the e-citizen. I said there are many. We cannot look at them exhaustively because of time. So we know that if we log into the e-citizen, we are able to actually renew our identification documents online. You can make vehicle registrations, search and register business names, also business permits. You can also report corruptions. You can also check status of your claims, because we are saying that it's a unified basket where all services have been placed, and it's just one point and you get served. Next. Continuation still for students. They are able to confirm their loan status or make applications. We are also able to check statements on our social fund. We can also perform land searches, the issuance of seasonal tickets, like in the city county. Then you can also register groups because those services have already been pulled together into one basket. Next. Now, that is how the e-citizen platform itself looks like. And if you look at it, you can see a mix of various activities or various applications that have been put together. So once you open it, you can see even issues, driving license, file returns, applying for birth certificate. These are being actually offered by different departments, ministries, but they have all been brought together, making the information and also data valuable to the citizen. So a number of government agencies, ministries, they have already onboarded their services, and that is just a snapshot of some of those particular organizations and ministries that have managed to pull their processes and operations onto the e-citizen platform. I do not need to talk more about that. Next. So now, if you look at now specific organizations, institutions, then you'll find that looking at NTSA, we are saying that through NTSA's Transport Integrated Management System, users are able to register vehicles, apply driving licenses, check vehicle details, and renew licenses. So they have come up with a system, and the same system is also onboarded onto the e-citizen platform. Looking at KRA, we are saying the citizens, they can file and pay taxes, they can check their tax compliance status, access tax records through the iTax portal. And I know this is something that you have been coming across when filling your returns. Also, looking at the Business Registration Bureau, then you are also able to register a business online, and also you can obtain a certificate of incorporation and also update business details in case there are some changes. Then the NSSF, we have just said that you can check for benefits, also contributions made under the land registry. You can perform searches, you can apply for land titles and verify land ownership details. Next. So looking also at the judiciary, we have now the e-filing system, which is also onboarded on instance the citizen platform, where litigants and lawyers can file cases, submit documents, and check cases, etc. Then the civil registration, where one is able to apply for birth and also death certificates, and also access other registration services. The voter registration, we are saying that citizens can register, vote, check their registration status. This is something that has been tested and utilized. Next. Still in line education, we are saying that those people in the remote areas, rural areas, they can still access this quality education through online and virtual learning platforms. The healthcare, the telemedicine, we know that the health apps, they can actually improve access to medical services, diagnostics, and health monitoring, especially in rural and served areas. Then the financial sector, we know a lot of systems have been developed. We have the financial technology solution, that's the fintech, a lot of them in different areas, like maybe payrolls, like for example, issues procurement, etc. Next. So now still you'll find that also the county governments have not been left behind. They have tried also to ensure that their services activities are onboarded, and I've just picked some of them, like the parking services, the business licensing services at county levels, the land services, property services, health services, like the Apia Makueni. There's also the e-commerce, Soko Makueni, the sales management, among others. So even the county governments have not been left behind, and we are saying that these income services are part of Kenya's broader vision to enhance digital governance and improve the quality of public services. So the government continues to invest in technology to further streamline processes and make services more accessible to Kenyans. Thank you.
Thank you, Erastus, for that elaborate presentation on e-government. And no wonder Dr. Yagon told us about creative economy, because even the government departments also have embraced the e-citizen. How many of us have ever utilized it? How is it? It is? Yes, it is user-friendly. And also, I realize they are also giving feedback. And they alert you on phone, and they alert you on email. They are really keeping up the pace. We want to compete with that one of KRA that it seems as if when you do your returns, nobody can get in there. So at least the government has also embraced it, and this is good because it shows that whenever we also employ our innovations in this field of P&D, population and development, we have political goodwill to do that. Now, before we go to the next presentation, let us all stand. We call heavens. They're calling heavens. They're not calling them nicely. Yes, we call heavens. Then we call them sideways. Then we call the floor by touching the floor. We are touching it. Kabisa. Kabisa, kabisa, kabisa. And then again we call sideways. I want us to do a big jump. Yes, a big jump. We're on ground floor. So nobody will be careful. So 1, 2, go. Masai! Masai! Very good. Thank you very much for that. We want to usher in the second presentation. And I believe this one is being done by... Let me ask, do you have any queries for the first one? Let me lump the 3, then we do. And you know, I'm still waiting for even our online team. Kindly raise your hand just in case you have a query, and then we shall handle it. The IT team there will let us know once we have somebody who wants to ask a question. So I want to welcome Margaret. Achar, tafadhali, come on board. We see those potatoes. Yes, we are going to the showcase number 2 on innovations in agriculture and agribusiness. This is one site visit that I missed. NCPD went to this farm in Kajiado, and those of you who are here during tea time, you are seeing some photos of Mwaila with a red kofia there. You could not even have said alikuwa farmer that day, and they really went to Kajiado County to see this farm. So Achar, karibu sana, and take us through.
Thank you so much. Still morning. Yes, good morning. You've raised people's expectations, and I'm wondering what to say because not that heated. My name is Frederick Achar. I work with Kilimo Hakika. Kilimo Hakika is precisely precision agriculture, but then we do more than precision agriculture. So for today, I want to bring to us some innovations. Of course, there are millions of innovations in the agriculture sector, but then aligning them to the theme of our meeting today, I saw something someone will remind me, it was better what, and better what. I saw some 3 things. Under the main topic of today's discussion. Yes. So what were they? The IT team, can you take me back to celebrating the title, the green one? Yes. Okay. Our population, our prosperity, our responsibility. But then I've been wondering loudly, I will ensure that I utilize less than the time I was given, but I was wondering loudly, what would happen if there was no birth control? I mean, if there were no issues with population control, people are just left like animals, what would happen? Or what is the risk? Uh-huh. Yes, yes. Everyone, including the online team, you will excuse me. I'm a farmer, so if I use a word that is anti-health, just excuse me. But what would happen if there was no population management?
My response is simple. That's what will happen is that there will be applying the law of the jungle. Then you do the way you envision, the way you think it is right, whether it is wrong or right, that is how you know. So
What is the risk of?
the risk of the problem now is sometimes it leads to anti-development because we will tend to sabotage ourselves. Even in things, when you train people and you manage population through the programs that exist, people are oriented to follow a certain way. But where there is no law, it will be trial and error, and there will be no progress. That is what I can.
Thank you. I look at it from an economic perspective, of course, through supply demand. Of course, we all know that there are scarcity of resources, and human beings actually compete to, get these resources. There's scarce food, there's scarce water, land. So when you do not manage your population, then you run the risk of having so many people not benefiting from these resources that are scarce. Basically, the supply and demand of these scarce resources is the big question when it comes to population management, from my perspective.
I think he has just said what I wanted to say, but my point was competition of the limited resources.
Thank you so much. Economists say those resources will always be limited, right? So there is, I'm asking that because in every attempt, every day, of course, everyone, I'm in a sector where we will only prosper because you will keep eating every day and everyone will continue eating. And that food must come from agriculture. There are attempts to do alternative meat sources other than the cow, the sheep, and so on, to do using technology to avoid greenhouse gas emissions by making synthetic meat. But then, even then, we will still have to eat. And so a greater population is going to still depend on agriculture. Now, there's been a lot of advancements, and looking at that, most of the sectors, the economic arm, the technology arm, they've come together, or they've launched into agriculture to innovate solutions that would make production sustainable and continuous, and especially addressing issues at the farm. So there are millions of innovations, there are thousands of innovations around agriculture in the world, but I will just highlight a few and give back the question to us. How many of you are in the innovation sector, technology, anything? Anything data analytics, anything machine learning, anything AI, anything innovation, anything? How many? You. 1, 2. So today on digital solutions for food security and livelihoods and economic development, we are looking at, from the agriculture perspective, what would make us have food for the current and upcoming population. I always feel very bad when there are speeches around food security nationally, continentally, and globally, and then someone starts with 7 million people die every year because of acute hunger and all that. It's painful. But then there are alternatives, so there are ways in which these things can be improved. Land will not increase. Resources we mentioned, population will always increase. And the best thing, most out of what we have, using the digital advancements that we've experienced. And going back to the very first presenter, is it first presenter? So somewhere there about. He asked, what can be done? And that makes a greater part of my presentation. That what can be done using digital solutions is to make technology and innovation turned into a service. Otherwise, the fear of the expanding digital divide, and we remember that for a long time there was a conversation around gender divide, where there was conspicuous disparities between men and women. And now there are digital solutions, or there are technology solutions that have come, but they are not only expanding that divide, but there is a new disparity that is arising between the digitally enabled and the digitally disabled. So for us to bridge that gap, for us to narrow that gap, it is essential that we turn digital solutions, technology, and innovation into a service so that it is accessible to majority, regardless of their gender and their skill set. And that answers what was asked about how to ensure that digitization does not only does not leave some other people behind. Okay? So let's proceed. As Kilimo Hakika, what we do majorly is to validate digital technologies and agricultural technologies that have been developed and ensure that they meet or they respond to the needs of the farmers or to the needs of the adopters. And so once we do that, we support in their scaling, but then we not only support in their scaling, but also support in their sustainable use. So we engage people who think that they have solutions in agriculture. We engage them to test those solutions at scale. And that is where we grow literally what can be grown at the farm and expose those solutions to that farm environment before they are scaled. In other forums, I would really, I don't know how technical people are here, but I would really vouch for the government sector to think through innovation sandboxes, because it saddens that when technologies come, they are developed and sent to the farmer, sent to the ground, sent to the adopters. But then when they fail, nobody follows up to call accountability to any of these developers. So if we could have had technologies or innovation sandboxes where these people are exposed to testing, validating, verifying, and qualifying their innovations and technologies before they are taken to the farmer, so that the farmer or the user is not used as a test bed. You get me? So that you as a user of a technology, I love e-citizen, and I was really delighted. I do most of the things that I do. I don't love queuing. So I do a lot of government things and legal things over the e-citizen portal. So I'm a big beneficiary of e-citizen. But how about if e-citizen collapsed today and nobody asked questions? So it's important that the responsible authorities, of course with the report of this conference, encourage innovation sandboxes that can be used to test innovations that bring solutions to the agriculture sector, especially to our vulnerable farmers who are really desperately looking for solutions to address my last slide: efficiency, increased production, reduced cost, improved market access, because these are the things that the innovations should address in terms of service delivery. Next slide. Apart from what we do in innovation, in validations, we also do other things to keep ourselves afloat, and that is not very important for today, but we do research and development, we do consultancy services, and we do model farming. In our model farming, we also literally farm to sell and to eat. And I welcome you all to Kajiado Farm. I welcome you to Migori if you're there. Kajiado Farm, we do horticulture. Migori Farm, we do poultry. Homa Bay Farm, we do many fruits, pawpaw and pineapples. Homa Bay. The sweetest in Africa is in Homa Bay. Come and prove with us. I will show you the farm and you pick and eat. But then looking at technology, so this is just what we do probably as Kilimo Hakika, which I have really spoken to, is that we look at what does technology have to offer for the current situations of limited resources but with increased demand for farm produce. So we look at what innovations and big data disruptive technologies can do, and then we integrate them with research in terms of the needs and the feedback of the people. And we develop tools together. We digitize those tools so that they are easily accessible everywhere, anywhere, not necessarily having to have an extension agent walking to those areas. And then those products or the content that are developed are released to the broader population for consumption, but with the stronger capacity building and continuous support so that they are able to utilize the technologies as a service. And then we encourage that once they've seen the benefits or they've seen the use, then we scale. So our intention is that the whole world, Africa and Kenya, can utilize these technologies such that if there are innovations and technologies that can be consumed virtually, then a Ugandan farmer in remote village should not wait until a Kenyan staff expands their operations to Uganda. We get it? Yeah. Next slide. We have a couple of, the one before, we have a couple of digital tools that we mention or that we utilize as Kilimo Hakika. And I mentioned that Kilimo Hakika, we are a model farm. Someone can come to our farm, learn what we do, utilize the tools we utilize, and gain as much as we do. And so part of what we use to address the issues that the farmers face or the issues that the farm faces are tools around weather advisory, tools around market access, where for weather, we use a platform called Ignitia. Ignitia, so far, based on our validation, there are several weather information platforms. There is Ignitia, there is Kenya Agricultural Observatory platform, there is Tomorrow Now, there are several others. There is even Google Weather, right? But so far, we've validated that Ignitia provides one of the most accurate weather predictions. For market, there is CAOP, and CAOP is free and open access by CalRO. Kenya Agricultural Observatory platform. I'll show you the interface, how it looks like. And then there is virtual farm monitoring. And last time when I was in this similar activity, I asked, how many of you are farmers? And I know most of you are thinking of retiring to the farm and do some little farming. But before you retire, you could be doing something over there. And as you do something over there, you might need to be able to access and see your farm. So we are currently validating this solution that uses satellite images and georeferencing to help you see your farm in real time, especially in terms of the needs that the soil have, or the needs of the soil that you're growing. So you are in Nairobi, you can log in, check the crop performance, and with the crop performance, instruct the person on the ground, you being a telephone farmer, instruct the person on the ground that go to the corner next to the big tree. It seems the plant has. When was the last time you watered the tomatoes? You get it? So these are the things that we are trying to look at. Now that there is population increase and pressure on food demand, you cannot retire, leave work to go and farm. But as a telephone farmer, you should also be able to see in real time what happens in your farm. We also have, as we mentioned earlier in the previous slide, that in terms of capacity development, in terms of supporting, in terms of knowledge and skills increase, so that they are able to utilize the solutions, we on an online platform that can be accessed just by simply registering your phone number. You can access those courses. There are video clips that you can access and learn basics of using digital tools to improve your agricultural practice. Again, there is CABI. And then on agro-advisory, we are currently working with CIMIT to develop a farmer chat where, using the existing technologies that farmers are used to, we have a WhatsApp channel that you can ask questions and get answers on agriculture in anything. It's currently under development, but we hope that once done, then farmers can utilize the basic tools that they are used to, WhatsApp, to get agro-advisories. If you ask me when the last extension agent, I think if we ask Moila when she last saw an extension agent in their village, she may not remember. But if the people in the same village can utilize WhatsApp to get verified agro-advisories, then we will have utilized technology to improve their production and activities in the farm and reduce the number of people who die from hunger because of low production and lack of food. We move to the next slide, but I would also want to mention that there are other tools that are used for farm record tracking. Farming as a business is an investment. In investments, you look at what goes in and what comes out, right? So, and remember, with a farm, you will not invest today and get your returns tomorrow. So you are likely to miss records of the activities and the costs incurred over time before the harvest season. So there is a platform called Farm Monitor that can help you to track what you put in the farm, days, type, costs, and everything that you put in the farm, and ultimately at the end of the season, get costs versus outputs to calculate whether you made a loss or a profit, and then make decisions of whether to continue or stop. Remember, there is no one size fits all. The weather solutions will not solve the risk of you over-investing in farming. Am I speaking to anyone? So you will get weather information. For instance, Ignitia might tell you it's gonna rain in the next 3 months. This is how the rain is going to spread. I would have told you to click that audio link, but it will need me to log in, so just leave it. But it can tell you daily weather, no, actually hourly weather, including wind, temperatures, and moisture, precipitation and all that. It will tell you weekly, monthly, and seasonally. It can give you history so that you track how has it been. Should I plant or should I not plant? Should I invest in agriculture or should I not? Should I invest in this crop or should I not? But that is not enough. Because I know people who put so much in the farm because they love the farm. But at the end of the day, do you want the farm to eat you or you to eat the farm? Yes. So the Ignitia app will not solve the problem of you over-investing. But then the farm monitor will help you because then you will know how much have I put here? What am I likely to get? Then you can decide to save some part of your resources if the risk is too high so that you still don't go hungry having invested and thinking that the farm would give you what to eat. So Ignitia, the reason we love it and the reason I raise it in this forum is, one, that the information, the weather information is turned into a service through SMS advisories. They know that it is likely to rain, but that's not enough for the farmer. The farmer needs what? So, okay, the farmer is asking, so what? So the SMSs that come, they could all either come in WhatsApp or WhatsApp or SMS, but then this is for more of the technical part of the organizations or bigger agencies that are dealing with farmers, say the World Food Program, with their farmers that they've listed, or FAO, they have a dashboard where they can see this. But then the farmer will just get messages either in WhatsApp or text as to, it is going to rain in the next 2 days, it is going to rain tomorrow, so do not water your plants. Otherwise you risk having waterlogging in your farm. So the farmer has knowledge or information and an action point. You get it? So these are these are the solutions that we are trying to highlight, because once the farmer has that real-time information, and that information is customized to the crop that is on the farm at the time, then they are better placed to utilize their resources effectively. Next slide. So the next slide is, I think, on Kenya Agricultural Observatory platform, where this is a Calro solution, and you can access it for free. And I think when you just log in, you'll see this. And when you see this, this is weather prediction for a whole week. And the weather prediction for a whole week has the chances of rain. It has the temperatures, particularly when we as Kilimo Hakika, we are farming in the dry Kajiado. So you get to know whether or not you should water, and whether or not, if you harvest or if you plant, you're likely to have an effective outcome. So apart from weather, there are agronomic advisories and there are market information on the daily, on the particular crops that you select. But what is interesting about Kenya Agricultural Observatory platform is that you can sit in Nairobi and select where exactly your farm is, or the ward where your farm is, and then get this information. So you as a smartphone user, you can still advise someone at home that, you know what, ndio nimekutumia pesa ya fertilizer, lakini bado usifanye nini, usipande. Ndio? Because you can just check, kwetu ni Siaya, sub-county ni Rarieda, ward ni East Asembo, and I click submit, I will be able to see this weather, get agronomic advisory based on the crop that I have selected, and the market information of inauza wapi pesa ngapi. We used to hear some business news. Leo maharagwe inauzwa pesa fish is bad. Leo maharagwe inauzwa pesa ngapi wapi. Right? So that kind of information is on this free platform. The next slide. I mentioned that you could sit here as a telephone farmer and know which part of your farm has stress. There is an application or a platform called Farmda. Farmda uses AI and machine learning and Earth observation and GIS, satellite data, to tell which part of the farm has which issues. And those issues include mapping your farm based on which areas are more productive and which areas are less productive. How important is that information for the farmer? It is important for targeted input supply. If you know that this is your farm, this house is your farm, and you want to plant a crop like tomatoes, and you want it to perform well, but then this solution helps you to know which quarter needs more fertilizer and which quarter needs less fertilizer, so that you don't just pour. Eti wamesema, everyone understands Kiswahili. Wamesema DAP ni kijiko mbili kwa shimo, right? So you don't just put DAP kijiko mbili kwa shimo na kuna mahali imetosheka, right? So you ensure that you wisely distribute your resources as per the need of the soil for the crop at hand. They do that by giving you color maps, and the color maps would then delineate the farm based on the productivity zones. So based on that color map, remember the color maps have keys, and those keys tell you the yellow area is this way, the green area is this way, and the red area is this way. So these ones, there's 5 key components. The productivity zones, by grouping the farm sections into productivity zones, which areas are more productive, which areas are less productive. Soil organic matter, which is very important for the farmer. So it again groups the farm by soil organic matter, by plant health, whether the plant is doing well or not, plant stress, whether the plant is facing some artificial trouble that you could address by just maybe doing water, fertilizer, and all that. And then lastly, the nitrogen zones. These are key for farmers so that they optimize the production of the farm at all corners. Shamba itakuwa tu hapo vile ilikuwa, but then now you know which area do I do better and which area does not need interventions. The next slide. I mentioned already on the issue of development, skills development. And so another free to use platform is the Kabi Academy. And Kabi Academy has consolidated a lot of advisories on farming activities. And the reason we advise on platforms like Kabi Academy is that, of course, if you Google, how do I do poultry farming? Utapata answers, ndio? But do you have someone who is responsible for that information? Use it as your own risk. So places like Kabi Academy are particularly verifying and consolidating properly researched information and simplifying it in ways that can easily be taken and actioned by users, including the small-scale farmer who never went to school or who just had basic education. As long as they can read, they can get all these skills. So if you open these programs, you will realize that they can easily be executed by someone who is just sitting home for a holiday to just train or teach a farmer, or even the farmer themselves reading these to get skills that they would use for their agricultural practices. And I think that goes also for the subsequent slide, where now CIMMYT does the same, but now the difference between Kabi Academy and CIMMYT is that the CIMMYT platform now allows you to undertake those same courses in English. The current one was developed for India and Mexico, but we are in the the process of curating courses that are relevant to Kenya, and they will be hosted on the same platform, and they will be accessed through WhatsApp. Now, the interesting thing about it is that they are animated into short videos that a farmer can just watch and listen and then get the skills. And next, apart from that, I mentioned the issues of farm planning. So this one is the one that we are validating currently. It's called Farm Monitor. You check online, you can see them. It is based in Nigeria for now, but we are working with them to develop it and customize it to Kenya in terms of location, currency, units of input use, and sources. And when that is done, then farmers will be able to log all their farms on board, tag them using GPS, like just map a pin on the farm. And then now, every time they do an activity, they key in the activity for the farm in the column for the particular farm. Every time they think that they need to do an activity in the next 3 days or 1 week or 1 month, they can schedule that. And then they will get a notification reminder that, hey, today you are supposed to do watering, or today you are supposed to add fertilizer, or today you are supposed to do top dressing. Okay? And then, once they are done with the season, they can see their expenses vis-a-vis their output. At the beginning of the season, they can have a target that I'm targeting 9 bags of maize. At the end of the season, they can see the actual harvest and compare it with the target. This helps the farmer to know how close is the information provided by the seed company or the fertilizer company towards the solutions, the production that we as farmers experience. So I would have exposed you to a few of them, but I think the best thing I can do is to let you, when you go home, I give you an assignment which I will not mark, is you go and try logging into any of these platforms. See which one you can. Wangapi wanatumanga pesa nyumbani ya fertilizer na mbegu? Whether unatuma kwa ajili ya familia yako, yani watoto wako, ama kwa ajili ya wazazi. Wangapi wanatumanga? Mnatumanga? So it is your responsibility to follow and track that that money is properly used. So when you go home today, my homework is check any of these platforms. See which one is useful for you and the person you send money to. Then refer them to use it, especially the free ones. Because then, next slide, as I finish. Skip that. Skip those two. For some reason, just skip them. Then with that, we are able to sort this. You're the one who sends money. You know how painful it is to get the money. And when you send the money, you expect an output. You expect that by the end of the season, usiombwe pesa ya kununua mahindi, still. So the question is, did you equally support them so that when you send the money, they utilize the money properly? Farmers are interested in the following: which technology and innovations must address. Farmers want to see an increase in yield. Users of technology want to see an increase in yield, that they may get more than they usually get. Number two, they expect to get better markets, because one big problem that we are facing with the Nyanya Muliona was that the moment Nyanya ilitoka kwa soko, ilifika kwa soko, like, right? You people, for the last 3 months, I think you have been enjoying almost free. You buy Nyanya from a market, I don't know. The last 3 months, there has been a lot of tomatoes. Now the question is, the farmer analia anasema bei ni mbaya, lakini wewe una enjoy. The question is, can't the farmer do better? They can do better if they have solutions, digital solutions or innovations that can help them to access better markets. The same time when we are struggling here with excess nyanya, There is a shortage of nyanya in Turkana. There is a shortage of nyanya in the other drier areas. So the question is, how do we link the two using technology? The producer and the consumer market. Then good quality produce. There is an increasing concern over no sugar, organically produced foods, and all that, right? So the farmers want to see, how can we comply with the local market demands and the export market? Those are the things that digital solutions and innovations should address. Sustainable production land will never increase, and fertility of the soil will never improve if not deliberately improved. So how do these solutions, including solutions around soil management, soil testing, soil health management, the ones I showed you on which areas need fertilizer, which areas do not need, so that you don't overdose some areas and underfeed some areas, those solutions will lead to sustainable production. And then optimization of costs, making the most out of the money that you put or the resources that you put in the farm, and then efficiency. Efficiency is in the sense of, they always say, there's this photo that I saw with, was it water or firewood? Water on her head, a baby on her back, and what was it in the hand, and then anatembeza ng'ombe yende nyumbani. Can technology and innovation relieve them of part of that burden? You get it? So can technology and innovation increase efficiency so that time and money is well utilized, so that some free time exists? If they have to go watering sukuma wiki every morning, can technology and innovation have automated, say, solar-powered watering system that uses sensors to know is the soil dry or not? So the work of this lady will only be to ensure that there is a tank up here which has water. The rest is done by the technology. Ikiwa mimea inataka maji, it sends a trigger, water is released, it goes. So hiyo maji ya kichwa ya kusomba ama hiyo maji ya kwenda kumwaga imempungulizia mzigo. You get it? So these are the questions that we are asking. So the people or the users of these technologies, they do not want the sensors. Do you think the mama huyo mwenye amebeba maji kwa kichwa anataka sensor? She doesn't need it. But she needs that sensor to do something. Send a trigger to the tank to relieve her of the time. You get it? So these are the things that we need to address. And I hope that if we utilize the technologies that are available well and transform the technologies into, and the innovations into a service, then our agriculture will be one, sustainable. There will be more food and better nutrition. And our people, or the population that we're targeting to support, will grow and grow healthy. So from the agriculture perspective, we heavily rely on technology so that we utilize the most, we get the most out of the time that we have. As Kilimo Hakika, if you can go back just to those photos as I finish, that we have enjoyed that. So here is where you saw Moila. Hiyo shamba alikula nyanya ni yetu na mmekaribishwa wote. This one is the Kajiado farm. We do 60 acres of nyanya. And we do a lot of it, part of it heavily. We do testing of innovations. But then there is a bigger part that we just do for us as farmers utilizing these technologies for model farming, that you can come learn A to Z from us and go and implement. So there we have very healthy tomatoes you can eat at the farm. We also do other vegetables. We do cabbages, we do greenhouse raising of seedlings. So kama wewe unaogopa raising seedlings at the greenhouse, we do raising seedlings at the greenhouse for other farmers like you. So we can raise for you your seedlings, then you only take the seedlings when they are ready. The reason we do this is it needs ultimate care. And we have resident agronomists who do that so that you have around 98% germination rate. A sachet of that seedling is 35,000 shillings. You lose it, you just stop farming. Next slide. Apart from these crop farms, in Migori, we do poultry farming. So you're welcome to see them. This one, where is that? This is day old. This is week old. And then hawa ni wako tayari. Kama hizi ni za Christmas. So Christmas ukuje kwetu. But then we have a very big 6 acres of fruit farm. We do pineapples. A study by Plan International revealed that because of altitude and soils, the sweetest pineapple in Africa is found in Homa Bay. Yeah. That can go on record. So, because of that interesting part, we've chosen to strategically do pineapples in Homa Bay. And these ones will be ready soon. They're just about to flower. So when they are ready, I invite all of you to tuonje tukule. Yes. Otherwise, I'm passionate about utilizing technology for agriculture to improve efficiency. But for us not to leave anyone behind, for us not to increase or exaggerate the gap, we need to turn the innovation and technology into a service that everyone else can utilize. Otherwise, we'll end up that the bridge between those who are technologically disabled and those who are technologically enabled becomes so big that technology becomes a vice rather than a good. Sawa. So as we do all this, priority is that merge all those things that you think and develop and give the consumers a service. Sawa sawa. And with that, I assure you that if you come to our farms, we will not tell you about these things. We'll show you the SMS. It is only the SMS that we forward to you that kutanyesha kesho. We will not show you any of these things, Ignitia, what. Those are just complications of the tech team. But we will give you what you can go and implement. And that's how we encourage farmers to utilize them. That we tell them, if you register your phone number in the form, then you can know whether it's going to rain. That's simple. And then you can make your decision. Sawa sawa. And we use that to ensure that there is food security and that the people that are born within our lifetime and after are food secure. Any questions? I will take them after. I think, it was after the next presenter or after now? Yes, after the next presenter, I will be here to take any other questions, particularly on this area of agriculture. Thank you.
Thank you very much, Achan, for that. Good to find you. This is both at a personal level and at an organization level. 1, 2, go. Thank you very much. Ezekiel, who was just there beside me, I could see him shaking, especially when he had the 60 acres of tomatoes. He started salivating on the amount he'll get from those 60 acres. So basically, that's a good one, which is also speaking to us. And is this the first harvest of pineapples in Homa Bay? Oh, and have they been sweet? Okay.
I was. Oh no, you didn't tell me to carry for you some, but I was there last week and I carried some.
Okay, you'll do so next time. Apparently, just before we do Q&A, I don't think we shall do it before, because I can see time is really catching up on us, and we need to go to climate early warning systems just before we go for lunch. From now on, I think I'll time. Hiyo ni vile I wanted to start at that one, but I was an interested party, so I let it go. Now, for this climate early warning system that is going to be done by National Drought Management Authority, NDMA, participant. Meanwhile, I can see what Margaret is showing me. Just before that, can we do a Q&A? All right, Karibu.
Thank you very much. My question would go to Kilimo Hakika. Actually, this is the second time we're interacting. I think you're in Sarova as well. Basically, I love the approach that you've taken with the AI models with artificial intelligence to try and improve services towards the farmers. And I think actually with the extensive data that you have in agriculture, this surely has been quite interesting to see. By my question, I've interacted with the Agri Advisory WhatsApp chatbot. And the question revolves around the accuracy of the information that is provided. I think there still needs to be much more research towards natural language processing. I think to expand the language barriers. At the moment, it can provide information in Kiswahili and English, which I think is really, really good. But I think, as you saw last time, the Kiswahili is not that perfect yet. So I don't know if, as Kilimo Hakika, you are trying to conduct research on NLP to just ensure that the accuracy of this data is top-notch, and probably to expand this now to local dialects like Kikuyu, Luo, so that, again, the farmers are able to interact with it perfectly. Then another question is, I think there's something that's trending online on the data that AI models have been trained in, especially I think the one that most of us are well conversant with, the ChatGPT. It's trained on Western data. Most of it, actually the information that you get is mostly Western. I don't know if Kilimo Hakika, you're also trying to, the data that you're collecting, are you making that publicly available so that other AI engineers are able to utilize it to build or to perfect their models, so that, again, because expanding the services not only in Kenya but in Africa as large, we're able to make better models, more accurate, and of course now trained in African data as opposed to what is currently the models that are trained in Western data. Thank you.
Simple and technical, but then I just want to say, yes, language, especially natural language processing, is a real issue. And then to the data source. So at the moment, for instance, the farmer chat that we are targeting to launch once ready is based on information from Calro. Properly researched information about several value chains, technologies, innovations, and management practices, good agricultural practices, and other research papers that are based or hosted in Calro. We intend to also leverage the research information that is lying in shelves at the universities and other research institutions to customize the feedback or the information that is available in the farmer chat to Kenyan context, African context, and local context. Now, the other thing that we need to appreciate is when, like, Africa does not have sufficient financial muscle to develop these chatbots or agri-chats or even the AI models. There are a lot of brains, skills, and trainings. But then you find that we rely on the West mostly for resources to develop and execute them, right? So you find that there is always influence on who gives you money, controls what you do with the money sometimes. And that becomes a little challenge. But then there is there's concerted effort that is targeting, customizing all these solutions to the African context given the population that is consuming the output. So you find that ChatGPT, for instance, is heavily used by Africans, right? So initially, if it was not to be consumed heavily by the African market, there was no need for customizing any of the feedbacks to the African context. But now, because the African market is launching into utilization, there is a new emerging need to customize that information to the African market, and definitely such feedbacks exist to them. But for the agriculture ones, we are trying to customize it to local context. On the issue of language or natural language processing, natural language processing, we are currently working on a partnership with the Farmerline. Farmerline is heavy in Ghana, having curated agro advisories in local languages in Ghana, but now they have launched activities in Kenya called Farmerline, and they are prioritizing testing major languages in Kenya. One, Kiswahili; two, Kalenjin; three, Luo; four, Kikuyu; and I think Kamba. Once they succeed in that, the model will then be easily incorporated or customized to accommodate other languages. So at the moment, they are about to test the accuracy of the feedback based on those major languages in Kenya. They have succeeded in Ghana, but they are yet to test the ones in Kenya. If they succeed, and then they will have cracked also a hurdle in natural language processing, and then with that, we can scale, I would say, in a simple word. We can scale to other main languages in Kenya, Africa, and beyond. Clarified? But of course, on issues of where the data comes from, we collect some data, yes, but we still don't have the ability to make them publicly available, given issues of data control and data sharing restrictions. But then there is also some otherwise rich data in the public space from the university portals and from research institutions like Calro that is publicly available as public good, and you could access it just based on request. Just request, do an email, authenticate that you are intending good use of the data, and then you get access to good quality data. And lastly, just something that is usually quite obvious. What happens at the counters in the supermarket? You do your shopping, they scan them, and then print your receipt and throw it out. They give you a receipt, and most of you throw it at the dustbin. They don't just give you receipts. They are collecting data. Because they could have done that in a different way, a calculator done. But that imprint, that record that remains in their side is collecting data. That's the data they use to customize their activities, their purchases, their sales and all that, their pricing trends and all that. So there is a lot of data anyway to even train AI models. But then the issue is the restrictions on data sharing, the restrictions on data control. And that is where I started with and said, if it was possible, and the government is here, I would request that in the report you include a request from innovation side that there be innovation sandboxes, so that the innovation sandboxes work in the sense of you can innovate, you can test your innovation in an environment that you don't risk failing. Like even if you fail inside there before you go out to the public. And inside there, you get everything that you need for your test. So if you want to develop an AI model and a tool and a solution, and you need data, even if you need data with personal identities, in the sandbox, it is safe to share all personal identities because it's not good leaving the sandbox. So you test everything and ensure that either it works or it doesn't work. If it doesn't work, you leave it inside there. Nobody knows about it outside. And if it works, then it is scaled with reality of it has passed the test. So within the sandbox, there is no, especially for an individual innovator, say you, within the sandbox, you don't need a license to access data because it's readily available within the consortium within the sandbox. So these are the things that we want to try to ask the government to allow or to set up so that even such data, an individual innovator can register to the sandbox, commit to the legal obligations, and then access the data they need to train, say, for example, an AI model. When it works, then now they apply for license because it's already proven. They apply for license to access data to scale it. Yeah.
Thank you for that clarity. Yes, 1, 2. And also, I've been informed ably that we'll be taking a break at 2. And so before that, we shall have a presentation from Ministry of Education, who is in another workshop, so we won't take his time for lunch to do that presentation. So ladies first, Lera.
Thank you. Just wanted to ask about the cost element for the apps, and to add on what you said, you know, the government creating an environment for the sandboxes, also calling on the development partners to fund innovation. R&D is very expensive, and yeah, it takes a while for things to actually work. So if there is enough investment in that, I think many innovations would actually be successful.
Good afternoon, everyone. Maybe mine is to share more information. We have sandboxes. Communication Authority has one. Also, ICTA has one. It's not a sandbox per se, but it's called White Box, where innovators can do their things there. And the good thing with ICTA is you get to be exposed to partners. I remember last year, there was an innovation in agriculture that was runners-up in a competition that was running in Connected Summit, of which it had all the biggest partner in Africa. So you can see a way in tapping to that. For NLP, I know of a project that is being run by GIZ. They're working on something on a chatbot also. As you said, it's easier to customize than to build from scratch. So if you can find a way to get into partnership with GIZ, maybe they can connect you on that. Also, why don't we think of centralizing all these? You have shared several platforms that a farmer can use. You know, it's hectic for me to switch from one to go to the next, to the next. I know with the use of API, we can develop a centralized system that hosts all these things and specific to that farm. Thank you.
A very great idea. The problem is one. Each of those solutions is a business avenue for some individual organization. And that also brings us to a regulatory request that if, just the same way, you see what has been done with e-citizen. The money that, technically the money that you pay for a legal document goes to the judiciary, right? But then you can access the service under e-citizen. You can just go to e-citizen, click on legal issues or even NTSA issues. If you want to pay for instance, for renewing a driving license or registering a motor vehicle, the transaction is more accounted for under NTSA, but you can access the service under e-citizen. The question is, can we get, I don't know who to address yet, but I will find, can we get an opportunity or a way in which the government or whoever, but government taking lead would be best, to have policies under which validated innovations are hosted on a single platform that is accessible to users locally. Yeah.
I may have a solution to the problem of it being a business of individuals. I know us from NCPD we use ERP. It has modules. You can have a base system like that has features that are free and then paid for, and then it is add-on. So if you modulate it into modules, it is easier. So that you also find the farmer that does not need everything. So they pick what they need and their system has it. I'm not sure that needs regulation, but I think that might work for farmers because you just pick what you need and the rest that is not yours, you leave it. Then the costing is done for what you, the services that you consume from the system.
Okay, thank you, Anthony, for that. Was yours Achar? You still have one more from the lady.
Oh, the cost of the apps?
Yes.
Oh, okay, sorry. Who takes care of the cost? Uh-huh. Now, I think, not I think, but the farmer takes care of the cost. Simple answer. But then, they are on subscription basis, so the farmer takes care of the cost. But then there are several that are free. So, for instance, I told you CALP is free access. There are some that, including some that I highlighted, are on subscription basis. But then the ultimate issue is, would you rather subscribe and spend 2% of your farm expenditure on getting the knowledge, the service, and then save the risk of losing, or go blindly and lose? So the other thing is on showing value, demonstrating value. So it is upon these innovators and innovation champions to demonstrate value to the farmer, so that when the farmer goes into it, he's not going into it as a test. They go into it knowing that there is value that they're going to extract from subscribing and paying for these services. Yeah.
Okay, thank you for that. And the maybe I had one when I saw that you can grow for me seedlings and then I get them ready. So you also charge that fee?
Of course, yes. We have a standard chart. We have standard charges for these activities. So that's business now. You can see me aside.
All right.
Let me just give you my card. You can see me aside. It's business.
I see you
I'm not making it secret. I can also do it for you. So I'm only afraid that I will take the whole team's time to do business. Yes. But you can reach out. We do that commercially. We do that for clients, and then we deliver to you once they are ready for transplanting. If you need extension of services, we can also extend our services by transplanting for you and managing it in terms of the whole process towards up to the harvest. Then you take care of the market.
Wow, these are consultants, farm consultancy. DOU. They grow the seedlings, you give them the farm, they manage it. I think I can also give you all the way. You sell, kama hii tea leaves. Nasikia nowadays tea leaves. No, the cash crop of the tea. If I don't want to, whatever, I just hire to somebody, and then we divide the bonus at a certain percentage. I think that's the way to go. I want to know whether the NDMA has told us we just chill a little. We see whether he'll get time from his other workshop. But I want, just before we go for lunch, we can deliver education to the last mile. All right. As we wait for these officers to to get ready, I want to invite from IPAS, who is doing the chatbot moja. We can do? Yeah, let's do one, at least to redeem time. If you're happy and you know, clap your hand. As you come. If you're happy and you know, clap your hand. If you're happy and you know. If you're happy and you know, stand up. As we go to chatbot moja, we are rising up. We stretch a little. Let's call the heavens. As he settles, we are calling the, and we hold on to our central government. We call the heavens. We call the, yes, the ancestors are holding them. We call them. Then we do Masai. We are doing Masai. 1, 2, go. Ai, surely. Kuna wanafanya hivi. Hivi. Na wasi ya lazima atoe kwa floor. 1, 2, go. Yes, I can see those ones who are doing the toes. But now, just chill a little. Sorry. It's called taking care of the opportunity. The opportunity is that MOE, Ministry of Education, has said anajoin. Na akijoin, alafu tufanya hii presentation, anaweza sleep. So let us give him just the 3 minutes. I hope they are Briton minutes, not African minutes. And then he does it, and then you come in. Ready? He's ready? Please, sorry about that, Steve. So let's do the one for the Ministry of Education. It is delivering education to the last mile. It is Samabaki. All right. Online team, Samabaki is online. We want to welcome him officially to Waridi. Some, if you're there, you can be testing your mic so that we can hear you. Some, if you are hearing us, we are waiting for you to start testing your mic. Online team? Is okay. Is he there? He is, eh? Okay, Sam?
Hello, now can you hear me?
Ah, beautiful. Yes, Bwanabaki, how are you? Sam?
Hello?
How are you?
Fine, thank you.
Yes, karibu sana to Waridi.
Yes.
And
fine, thank you, madam.
Yes, introduce yourself.
Thank you.
Yes, introduce yourself and also karibu sana. We are waiting for that presentation. Karibu.
Asante sana. So my name is Sam Abaki. I'm from the Ministry of Education, of Basic Education. I work with NEMIS, that is an ICT, and you all know, I believe you all know about NEMIS, which I'll simply be giving a presentation in some few minutes. And even apart from that, I also work also with planning on data management. So as a presenter, I should be able to talk about maybe the two. And with the small and the little time that I have, I hope I'll be able to do justice with what I have. And secondly, apologies for not physically being present with you. I would have loved to, but there are some things that you are doing at the department. I have been chairing the topic. That is why I haven't been available to attend physically. But thank you for the opportunity to attend online. Thank you. Hello, am I still audible?
You're audible,
Hello?
though there is some background noise.
Oh, thank you.
Yes, but proceed.
Yeah. Apologies for that. I don't know if the presentation will be shared or I'm the one to share, because I had shared it earlier on.
Oh, okay. Kindly some share it, if you can.
I cannot share from my end. It has been disabled.
Okay. Then let us do it from our end. Okay, Sam, we are just getting ready.
It's okay. And apologies once again. The environment I'm in, it's a bit noisy, but I hope you'll be able to filter out the noise and just concentrate on what I say.
Okay. At least you're loud enough. You are simmering that noise.
Thank you.
Okay, Sam, you can see our screen as well.
Yes, sure, I can.
And you can see the presentation?
Yes, I can.
Okay, then go ahead.
Yeah, so the presentation is simply on NIME's campaigns, its automations, and the data management. So for this one, I simply call it EMIS 2.0. EMIS simply meaning Education Management Information System 2.0. That is how we've advanced over time, and I'll be able to take us through that. Can I to the next slide? Yes, so here we're simply looking at the internet infrastructure and what is there so far. Yes, you can see the map of Kenya with some lines, blue, red, yellow, green. So those are simply cables. And so far, we do have 8 undersea fiber cables terminated in Kenya, which also has links internationally. And the aim of Kenya is to have 1,000 kilometers of fiber. That was between last year and part of this year, 2022, 23, 24. And its termination, it should be at the sub-county offices, right? The sub-county director of education office, and the node supposed to be cross-checked by ICTA. I heard one of the colleagues from ICTA who's also there. I don't know if they mentioned that, but this is what is going on so far. And this is supposed to connect all the schools that are along the path, simply using WiMAX. Yes. And WiMAX is a simpler technology that is aimed that provides wireless data over long distances. Actually, way better than what we have as Wi-Fi. And NEMIS is also used for tracking connectivity to schools program. NEMIS is also used to do that, tracking connectivity to schools. So on EMIS, even before we come to EMIS, it is simply an education management information system. And the efforts of EMIS has always been to establish data. And EMIS simply dates back to 98, where World Bank was the sole supporter of EMIS. And so far to simply update and bring this education system to date, we've simply had 8 attempts to establish EMIS, such that in 2008, we had a school map, and we're able to simply use GPS for 34,000 data using the paper. We call it paper-based. That is before we came with the online. How that used to happen is officers from the Ministry of Education could actually come with a template, rather a tool for collecting data. It was a We started from 3-pager tool to a 1-pager. We are able to scale it down over time. And once we had the papers, we used to print it in triplicates, such that the officer from the ministry will remain with one copy will remain to school, and another copy will actually go to the county director's office. And once we are done with that paper forms, we'll actually come back and now start entering this data. So most of our data was stored in Excel. That is between 2007 to mid 2016, 2018 there. That is when we stopped with the paper. But now with this paper, what used to happen is, one, we never had a dashboard. We never had a system yet. And we used to use Excel. So from the Excel, we'll basically collect data, do analysis. After the analysis, then we'll actually come up with the education statistical booklet from what we've collected from the group, from town. That is from the ground, that is from the school itself. And that is why we're simply saying that that was now MIS 1.0, the paper-based. And now we came up with the system. The system came in 2018. That is the online capture. And that is what most of us, I believe a good number of us are parents, or rather, even if you're not a parent, you have heard of NEMIS. Now that is what we have now online. And its main strength is it captures the individual biodata of a learner, and also it captures the biodata also of an institution. So the question is, why NEMIS? NEMIS is evidence-based decision and planning, and also health and policy making, management and monitoring. When we're using the paper-based, what used to happen is, to verify data that you're given, that a school simply exists, when everything is being written down on a paper, chances are a school can give any enrollment depending on what they'll be gaining. Say, for example, if you're doing application, and if I'm school X, chances are, since there's no system, I can definitely give you an enrollment of 1,000, and if you're 200 learners. Why that? Because I know if I give you that enrollment, you won't verify a good number. So that is why we had ghost capitation and we had ghost children, and even ghost schools. So the schools they're not able to verify where the schools are. On resource allocation, still we had the teacher-student ratio, because at some point we actually realized that our data, say from 2012 down to 2016, the teacher-student ratio was way high. That is before the system came in. So we also have monitoring and evaluation that the system is also able to do. Be able to monitor learning materials, that is quality assurance. NEMIS is able to do this. So at least we've been able to simply close most of the gaps that we had as education, and this is how we've been able to move forward. Next slide. So this is simply taking you to the design and the rationale of NEMIS and the data consolidation sharing. So from what we have data from KICD, where we have the ones who deal with the textbook, the KICD, the curriculum and everything. We have NEC, who deals with the exam. We have MOE, TSC dealing with the teachers. Then we have the labels of education. So all this data that you're getting from these institutions, we're able to consolidate them. Yeah? And once they are collected, they simply go to trusted master data. Now in this place, this is where, even before sharing that data, the data is cleansed first. It is consolidated, it's cleansed. Then after governed, then we simply see now more data to share. And once it is shared, it simply goes, all these data, they simply come from the NEMIS master database. Now this is where we have the raw data. Now from this, we can always put it in any form, depending on the user. Depending on the user need. Once we have everything on the database, that is the raw data, we're able to share from there back to the institutions. Next slide. Next slide, please. Hello? Are you able to move to the next slide? I believe this is the slide that we previously had.
Okay, let's check. We are checking.
Yes.
Sam, just give us a while. It's freezing and Hurlingham is hot.
Or can I try to share from my end? I see the sharing button has been enabled.
Yes, I think the sharing is enabled from your end as well.
So do I share or I not?
Yes, kindly try to share from your end.
Can everyone see that?
No. We are yet to see something from your end.
Is it visible to everyone? Oh, well, we're already shared.
Okay. Oh, all right. All right. Yes. That's okay.
It's visible.
Yeah, it is. Yes, it is. Go ahead.
Okay, so this is what I simply took us through the institutions that we are able. Yes. And so this is where we are sharing the institution data, and where we are simply able to pick that data and bring it to the NEMIS data master database. So from here, when we're coming now to chemists,
Sam, just a minute.
Kindly
make it.
NEMIS, now we are moving to chemists.
Sam, make it full
Yes,
slide.
please.
Make it full slide.
There. Sorry about that. Is it okay from your end?
No, you are yet to. Full slide. We are seeing the other slides.
Okay. Somehow slow. I don't know why.
Okay, it's okay. Yes.
Oh, because from my end it's full slide. I don't know. I don't know why.
Okay, just proceed.
Hello?
Just proceed.
Okay, yes. I don't know why it's not full slide, but from my end it's full. Unless maybe distance might be affecting. That's an assumption. But anyway, we have the GPS-based chemists. And on the scope is, as I said earlier on, now with NEMIS, we are able now to connect the specific biodata and even the details and more details of a school than what we used to collect on NEMIS that is paper-based. Now, on one strong factor about NEMIS was simply the GPS. We're able to map the schools in their locations, and we have those GPS locations. And when I'm moving to KEMIS, now KEMIS simply meaning Kenya Education Management Information System. That simply means we're moving to a higher version of NEMIS. And in this we are simply concentrating on every level of education. That is from ECD, that is ECD, primary, secondary, now to the university and TVETs. Now they are to be captured in this new NEMIS, which we are calling KEMIS. And this is being done in phases. The first phase is on basic education, where we have the ECD, the primary, secondary, and even the JSS, which are in the area. And the second phase will be able to capture the TTCs, TVET, MIS, and university, meaning all these systems that are in the higher education, that is university and TVET, shall use an API now to collect the data, and so that as the education being an institution, we should only have one true source of data, and that will be KEMIS. So even if you're in university or where, even the teachers, whenever you log into KEMIS, you should be able to get any detail that you need from ECD to the university. So this is the level that you're actually going to. Yeah? And yes, I simply put it as NEMIS 1 and NEMIS 2. NEMIS 1, as I've said, is simply for the basic education. NEMIS 2 is an upgrade. Now, from what we have in the NEMIS and CHEMIS, also improve our systems with other systems where we've been able to do integration with other systems. One of the systems is MOH. The MOH system, that is the DHIS. We've been able to pull data and pull and push data from the DHIS. We have the EPRS, the NHIF, as you all know. I know now, right now, it has changed. And why I've put it in red is because right now we've simply moved from NHIF to SHA. What happens in NHIF is before, let me say, the former government, all the students and the learners who were in secondary schools, they had the NHIF number. So that simply means that from NEMIS, where we have a unique number, all this unique identifier that every learner had, it was simply marked, or rather marked and mapped with an NHIF number for a learner. That simply told us that if a learner or rather student felt sick in school, they didn't have to call the parent. Yes, they could call the parent, but the student could actually go to any hospital and be treated. That is how we used to operate with NHIF. And the ministry, the government was not able to pay for the NHIF for all learners in public secondary schools for NHIF. And we have cases that even some of the learners who had serious medical attentions, they've been flown out to India, not one, but quite a good number, and we were able to pay for all of them. And that simply came under capitation in NHIF. So, of course, we have NEC, and as we go to the first two, HELB and CUSP shall be applied also through CHEMIS, because that will be the sole system that the education fraternity will be using. That is where we are heading to. Yes. So some of the modules that we have in NEMIS so far, we have the institution, the learner, the staff, finance, school health transition, and emerging program. I can just take us through very fast. What you have on institution, we have the biodata, we have the emergency reporting. The emergency reporting simply reports on the emerging issues and emerging cases. Say, for example, we had floods. So during the flood times, the schools were able to report on NEMIS if the schools were swept away or they are still existing. So we are able to map out the schools that were affected and even the number of learners affected. Yes, we have asset management and even the institutional management BOMs. So all these are actually found under the institution module. And apart from that, the first, which also we have reports. Under the learner module, we have the learner by data. Learner by data simply meaning we have the names of the learner, their birth certificate, the parents' contacts, and if the learner has a disability or not. Of course, we have the SNE section as well, and even the attendance list. And for the refugee, we also capture their data that is under the learner module. And at the staff, almost somewhat similar with what we have on learner module, not really different. Then under the finance, what NEMIS is able to do is, the big part is on capitation. Earlier on, we never used the system for capitation. That is why we had quite a number of ghost learners who were being paid, or rather who were in school in quotes, but they were really not. They are really non-existent. And we actually paying those who are not in school. But right now, every capitation for the free primary, JSS, and even for the special need is simply done through the system. And for a learner to be in the system, they must produce the birth certificate. That is the means of verification that a learner is on NEMIS. So capitation is simply based on the enrollment that is in the system. Yes, we have the funding that is also constructive funding in schools. We have the school fees that is also coming up, and I'm sure we've heard about this, that school fees shall be paid through the e-citizen, which shall also go through NEMIS as well. On school health, we have the school feeding program. We have the WASH indicators. For those who are dealing with WASH, we have those indicators and they're able to track WASH in schools. We have the deworming. Now, this deworming data is what we are doing. We're actually pushing our data to KHIS. EduAfia was there, but right now we're simply waiting for the next step that the government will take. and also able to track the sanitary pads that is being issued to schools as well. On transition is also a module, the transition from ECD up to the university level. That simply means that when you simply enroll in a school, the unique number that will be given, that is the number that will start from ECD up to the university. And in future, this is the number that will be able to issue you the ID, your ID number. So as we continue to transition and we continue to improve our system, we also continue to integrate with other systems that are already existing to simply give us an easier way, how do I put it? Easier way to link up and do things even as a country. Of course, emerging programs, we have sports and talent, textbook tracker is there, project status. If you have a project within the ministry or even schools, you're able to track that. And statistical reporting. Now, under statistical reporting, this is where we always issue our annual education statistical booklet. If you really need to see what data we have as a Ministry of Education, it is all available online under the Education Statistical Booklet. And apart from that, the last bit of the module is on data sharing. Of course, I say the NHIF API, we always use the APIs. We have the MOH, NACONEC, IPRS, NEC, and the university. So these are simply the modules that we are using as Ministry of Education and as NAMIS. Of course, I've talked about the module, and this is just maybe a brief writing on it. Institution module, learner module, the staff module, which I've simply summarized on when I was taking us through there. Yes. Of course, the last NHIF cover, it actually covered 3.9 million learners. That is before it was removed. So we are really hoping that as we move forward, that it may come back, because it really benefited a lot of parents. Yes. So the modules that have already been done and the new modules that we've already done so far, we have the scholarship management and coordination. Yes. I believe we've all learned about Wings to Fly. The CDF is also being done through NAMIS. KCB, that is simply on payment and every other thing on their scholarship. Learning materials inventory, and we're also working on a library that also be online through NAMIS. We have the auditing now done, it's being done to the system, that is CHEMIS, school infrastructure monitoring, and institution registration through eCitizen. And remember right now, every institution that are simply registering, they do not have to come to the Ministry of Education, but you can simply log in to eCitizen. Once you see the school registration, as you go there, you simply get a prompt on how much to pay. So once that is done, the receipt you get, that is what you take to the Ministry of Education office at the county level, and you'll be issued with a school registration certificate. So this is how far we've come so far. So apart from maybe some things I never put online, I forgot to put on my slide. We also have some monitoring tools that we use. And these monitoring tools are also linked to NAMIS. We have a tool called Tangerine. Tangerine is one of the tools that we're using for monitoring. Yes, it is like Kobo, a bit like Kobo, but it is able to do more than Kobo. So this is what we've been using for quality assurance of schools, for any tool and anything that we need to use as education. It has been the main monitoring and evaluation tool that we've been using in the ministry. It has been linked to NAMIS such that when data is entered into that tool, it simply goes straight to NAMIS and be able to do the analysis. And so that tool, the dashboard that we are using is Power BI. So for my presentation, this is simply a screenshot of what we have on NAMIS. So for example, under institution listing, this is how it appears so far. Yes, we are still working on our dashboard to see how it can be better and how we can better it. We have the names, the level, the status. If registered, of course, they're all registered. Type of school, they're an accommodation type. Then once you go on your farthest right where we have learners and staff, if the school, which is number 1 called AIC Ebenezer, and then school code, which is the NAMIS code, that is 2GES. If I click on the part called learners, then I'll be able to see all the learners in that school. All the learners in the school by grade, I'll be able to get that. Likewise, my staff, I'll be able to get that. That is what you'll be able to see once you log into NEMIS. Then on the learner listing, once I click the learner, this is what I'm able to see. I'm able to see even the photo of learner to simply confirm that this learner actually exists. So this is part of our evidence. You know, in Kenya, people can always come up and always forge the birth certificate. But one thing they cannot forge, of course, is the photos. So when a learner is being registered, they must take a photo. Then every detail of the learner shall actually be posted there. That is how it appears. The photo, the learner. UPI is simply the unique personal identifier. It's like an ID of the learner. Since the learner joins pre-primary until the learner finishes. So right now we shall say the UPI they shall use until they clear university. Then we have the learner's name, the gender, date of birth, the birth certificate number. Be able to collect data on disability, medical condition, and the NHIF number, as you can see. So that row is what we've simply done away with at the moment. But I believe it might come back as we go on. Yes, so apart from that, that is NEMIS, it was online. So as NEMIS, we also have this tool as an application where the same school uses the same unique number to log into this mobile app. And the mobile app is called NEMIS, and this is its Outlook. Yes, you have a place called the learner attendance, where the teachers are able now to log in and give us their attendance every other day as they update it manually. We have the teacher information where the teacher, once the teacher clicks, we have the information of the teacher. Then we have the food release. This simply tracks the food from the point that the food was released to the point that where the food is being taken. It's simply a tracker. Yes, food delivered. Once the food is delivered, that is where you're able to track and confirm it's delivered. Now on the treatment, this is where we simply have the deworming data. How many learners have been dewormed? How many learners are you planning to deworm? And how many have not been dewormed? And so this is simply on our mobile app. Just a glimpse on the attendance. This is what happens. As you can see, we have the grade, the boys, the girls, and attendance from grade 1 and the date that the attendance was simply captured. This is the attendance view on the mobile app. Yes. And apart from that, data exchange, MOA with help and boost, as I said earlier on, we have the institution biodata, learner and parent, and students in Tibetan, MIS, Managed Information System, that is Tibet MIS. Then we have the Tibet student ranking is also there, the CUSP, and finally the reporting. So far, this is how the system is going. And right now we are moving with CHEMIS. And the speed which we are moving in, we are hopeful that even by the end of the next year, we shall have university on CHEMIS. If you can remember the last time we had our Form 1s going into our last Form 1, that is last year, we simply realized that even getting the index number, last year, was it this year? This year, yes. We did not have to send a message to Safaricom. But once we logged into CHEMIS, you could actually see that place where I simply told you, write the index number, and the county and sub-county where the students start for KCPE. And once you click that, it gave you the results, and even the school that the student has been called. So that is how fast we have been moving with our system so far. Our compliance with ODPC, data controller, we have the learner bio, parent bio, and teacher bio. Data sharing with who and copyright registration, all that is in the system. That is our compliance so far. Now this is simply the journey that we've had. Started in 2015, that I won't give information. I know I talked about it earlier on. Steering committee, yes. We had the development. The developers was simply from government. Tibet MIS started in 2017. Yes, recommendation for transition to modern development tools. And finally, HEMIS. The concept is already done. They're pushing to harmonize with one for the university and the school. So far, this is where we are as education. And maybe for demos, this is the website. You can always check out what is there. And apart from that, that is simply what we have. as Ministry of Education. So thank you for your time. I hope you're good with that. If I've been fast, kindly let me know.
All right, Sam, just before you go, let us first of all clap for you, give you a clap. I hope you're going to hear it, and then we'll ask whether we have one or two questions for you.
Sure.
That one shows you took good tea. Now, you've seen what the Ministry of Education as far it's doing, as far as, let me talk about CBC is concerned, and the others who are there in the middle of CBC, and you've seen they have really embraced IT when it comes even to capitation, all those issues. Who has a query for Sam before he also catches some food and goes to his other meeting? Yes, Margaret? Any other? So at least we can do a lump sum, and then we release some. Okay, Margaret.
Okay, thank you so much. Thank you so much, Sam, for that very in-depth discussion. And my question is actually, okay, maybe not a question, but a comment that I thought you would also give us some insights into how the Ministry of Education is reaching learners in hard-to-reach areas, because we are talking about last mile, we are talking about leaving no one behind in terms of getting an education. Maybe you can just give some key highlights. Thank you.
Okay, Sam, maybe you can tackle that.
Okay, how the ministry is reaching those learners. Of course, let me say, basically, to make, you know, the ministry, you always say that every learner counts. That is one of our things. As you all know, say, for example, what we had some time back with our late CS, that is the professor, we realized that he really tried on his end, and that is why he's one of the people who actually strengthened this system, so that we simply make sure that every learner, one, has a birth certificate. We really tried with that. We tried with the chief. We tried to work hand in hand to the Ministry of Interior to see how every learner can actually get birth certificate, one, on time, so that they may not miss out on what is simply happening in the education sector. And the step that he took, that he was able to reach out the Ministry of Interior, and the Interior was able to reach out to the chiefs. The chiefs, yes, they had the barazas with every village that was there, and they actually provided a way for them to get the birth certificates. Now, sometimes, I know it is always difficult with some parents who do not know what a birth certificate is. But with the chief, they really tried from their end. And with that, that is why we are able to actually have a very great increase in enrollment, even on the system. Because when we started with around 4.5. And right now, as we're moving, we're almost 8. Okay? We're actually clipping 8.5 in terms of enrollment. But that is simply on public schools. So in terms of reaching out, the ministry has really tried, and we have not yet stopped. And that is why we still have, we're still working hand in hand with the Ministry of Interior. We're still working hand in hand from the national government to the county government, and with the county officials still at the field, because they're the ones who are able to recognize and know these schools. So every time we really try, because our main focus is also looking at the transition rate. How the transition rate, the net enrollment rate, how many learners are there, rather how many children are there who are not yet in school. So we're really trying to put all this mechanism to simply reach out to them. And one factor that has helped us also is the school meals, the FPE, free primary education, and the school meals. Because we realize that the children from hard to reach areas, where there is food, they will always go there. So the program of FPE, free primary and free meals, has really helped us in that, and has helped us increase not only enrollment but also transition. If you go to Ghana, where there's no food, the schools actually always closes. The schools close. So the ministry has really tried with that program. That's why the program is still there and goes on. So I can say that is some of the measures the ministry has taken. Yes, through capitation and through school meals, and of course, through door-to-door using the chiefs. I hope I've been able to answer that.
All right, yes, thank you, Sam. Waila here has nodded her head that she is okay with that answer. Anyone else? That is our education system, and that is what the Ministry of Education is doing as far as embracing IT is concerned. So Sam,
Yes.
Yes, we really want to thank you for taking time to be with us for those about 30 minutes. And just in case of anything, I know Margaret has you an email. We can get you online via the other channel. And thank you so much, and enjoy your lunch hour and the rest of the day. Thank you.
Thank you.
Yes.
I appreciate it.
Thank you so much. Back to the physical audience and the others that are online. We are releasing Sam because he has another meeting to attend to. And I can see it is 10:02. No, actually it is 1:45. 1:45. All right. I understand it was fixed. We have to go at 2 for lunch. Steve, I think we can have you for 15 minutes, and then we go for lunch at 2. This also is keeping time so that at least we can see the things we took at tea, at 10, at 11. Yes, so karibu. Let us, if you have the program, we are in showcase number 5. We are to have AYSRH chat box. We are to have one by IPAS and another one by RHNK. So actually we are at midday. We are between 1240 and 1300 hours. But we're and you're awfully quiet. These digital things, I'm at Facebook. We need to go to Facebook. We go to TikTok so that we can hear those ones who will keep saying, I want trouble. Okay? Those ones are the ones that make us to smile all the way. So, Steve, karibu.
Thank you very much. I acknowledge I'm standing between you and lunch. So I'll just go straight to the point and hopefully make it shorter. So my name is Steve Biko. I work at IPAS where I lead pharmacy channel contraceptive project. That project is implemented by a consortium of about 4 partners led by IPAS, Population Council, Impact for Health, and NIVI. For this presentation, I'll co-present with my colleague Jacqueline Cheriot, whom we work with in the project. So the title is Using Digital Tools to Support Post-Pregnancy Contraceptive Uptake and Continuation through Pharmacy Channel. All right, pharmacies are increasingly becoming a first point of contact for primary health care. Given their training, they are not able to provide comprehensive care package because their training, because their training is heavily provision of providing prescription and reading those prescriptions. So encouraging them to provide comprehensive contraceptive services requires a training for them to be able to provide that care that is personalized to the needs of the client and is able to encourage consistent use. So in a pharmacy channel without linkage to facilities, clients seeking contraceptive there are not able to get informed method choice. Next. Yeah, so PMAC project develop different solutions, including digital interventions that are evidence-based, scalable, and are able to increase uptake of contraception among women and girls who sought them at pharmacy channel. The project has different design processes, starting with a formative research phase, human-centered design to be able to incorporate the needs of women and girls into the design process. We've tested this through a pilot study, done a market system development plan to build this market because it's happening outside health system that is not really, that does not have a proper stewardship from the National Ministry of Health. Then we've done adaptive learning to be able to incorporate every learnings that we've gathered into the design process so that we are more responsive to the contraceptive needs of women and girls. At this phase in time, we are planning to do a final evaluation and hoping that these insights will be able to build better stewardship of the sector with the MOH at the center of it. Next. So this is the intervention package. We are working with pharmacies to improve quality of care. Also building a business case, but for the purpose of this presentation, I'll only focus on the business case aspect that will largely delve on two very critical aspects. So one is connecting clients directly to pharmacies who are providing contraceptive method, and also in return building business opportunity to the pharmacies to be able to get something. Probably you understand by now that contraceptive service delivery requires counseling, and that time invested, there's an opportunity cost in terms of service to other clients. If they had dedicated time to just dispense, as opposed to providing counseling, then they would have made more money. So the business case aspect here is to be able to take care of that opportunity cost that would come as a result of investing time to provide counseling. So for the presentation, I'll invite my colleague Jackie to take us to take over from here. Thank you. Next.
Thanks. Good afternoon. We are standing between you and lunch, so we'll really be fast. Yes, so basically under the PMAC project, one of the interventions here is Ask Nivi. So Ask Nivi basically is a WhatsApp chatbot. So basically it's a chatbot that is available on WhatsApp that is free and accessible to the end user. Next. So what are we trying to do? What is the problem in the market? You realize that you know, like the consumers of health services are on one side, and the providers or the health system providers, actors are actually on the other side. Then there is a gap in between. What Nivi does is to come in between these to connect the providers, who are the health system actors, to the consumers of these services. So that's what we are doing in the, you know, like for other, within the SRH space. Specifically for the PIMA project, we are doing it for family planning, and it's for post-MA FP and also FP. Next. So like I said, we use AI, we use data insights to actually develop, you know, tailored journeys that are then delivered through WhatsApp. We realize that there's a market segment that do not have access to WhatsApp. But also, there's a bigger market that has access to WhatsApp. Literally, almost everyone does, like you do your chatting, your phone calls via WhatsApp. But also realizing that 1 in every 20 Google searches is actually a health-related search. So why don't we then provide verified information through a very simplified, easy channel? And that's where Ask Nivi comes in. So we do digital counseling. So we also do referral. So digital counseling, what happens is once a user comes into the Ask Nivi chatbot, they are taken through a series of tailored questions. So the first thing that we ask for family planning is, what is your objective? What are you here for today? If your objective is to prevent pregnancy, then we ask you a number of questions. We ask you, like, when would you want to get pregnant? Is it in the next 2 years, or is it like you want to prevent pregnancy in the short term? If you want to prevent pregnancy in the short term, we will give you methods that we will advise you on methods that are short-term methods. But if you want to prevent, if your goal is to prevent pregnancy for a longer period, then we will suggest long-term, what we call long-acting methods. And then after you have received a method, we also come in as a digital companion, meaning that if, for example, I took up a method that was for 3 months, right before my next refill, we will send you a nudge a week to remind you that you're up for a refill, and also remind you, like link you to service providers where you can receive your method of choice. So that ensures that there is method continuity. Next. Yeah, we talked about behavioral science and, like AI and insights. So basically, Ask Nivi works in 3 ways, what we call the 3 A's. So the first phase is where we call the awareness. Awareness comes in where we do segmentation. Who are we targeting? Who is this person that we want to reach? For FP services, what is the segment of the market we want to serve? For the project, we are looking for young women between 18 and 40 years or 42 years, basically women who are of reproductive age. And then, so what we do is, once we are able to segment, we then support with tailored engagements, the messages that have been structured specifically, like to serve that specific segment. And then we go to the next phase, which is activation. So here, activation phase is where the objective of this phase is basically to increase the level of readiness. What we call, what we use behavioral science here to move a person from one level of readiness to the next, with the intention of making sure that the person is well informed for them to make that decision to actually take up a method. And then now the action phase, which is now linking this interested, like potential client to a service provider. So that is basically the 3 A's that we use under Ask Nivi. Next. So we have different entry points, and one of the entry points is we utilize social media. utilizing social media to reach, which is the awareness phase, to reach to the population that we want to serve. So this is a typical meta, this is Instagram, Facebook user journey. So it starts by a person, you know, like seeing Ask Nivi ad on Facebook or Instagram. And then the call to action here is for the person to click on the link. So what happens is once they are able to interact with the ad, they transition directly to WhatsApp. And in WhatsApp, this is now where they begin the conversation with the objective of educating, but also, you know, like linking this person to service points. Next. So basically, under the PMAC project, our target audience is the project is running within Nakuru County. So we are targeting women of reproductive age within Naivasha and Nakuru. So 30% radius. But as we have continued to do the project, we've realized that also the providers have been getting referrals from all over the country. So we have virtual resources also as referral points within the chatbot. Next. So we talked about entry points. One of the entry points basically being Facebook, Instagram, Google Ads. We utilize a lot Meta because that is where we have, you know, like Meta provides a platform that you can do a little bit more than Google Ads when it comes to segmentation, when it comes to also the audience. Many people are actually on, you know, like there's a large population on Facebook and Instagram. Next. Another entry point is through flyers and placements at the partner pharmacies or, yeah. So we do have posters within the partner pharmacies. We have QR codes. QR code stands. The picture there just shows a pharmacist with a QR code stand. So what we do is with the partner organization or partner providers, we do encourage them to introduce Ask Nivi or to bring Ask Nivi into the conversation for every footfall or for every customer that walks into their business. The reason being, you know, working with the providers or it increases, for them it's one way is for them to be, they have a unique keyword. So every provider has a unique keyword where within the chatbot we can track that Jackie today onboarded from a provider A. And Jackie has done ABCD within the chatbot. And next time Jackie is visiting or is seeking services, the first point of referral will be the keyword for that provider, will be that provider that Jackie onboarded from. The reason for that is to be able to help the provider to retain customers. Another entry point is the business cards. So, you know, we do share with the providers. We work with community health volunteers also to, as they work within their community, they have small cards that they can share with people within they interact with. And we use that to onboard to Nivi. So there's a QR code, or you can, where a person can scan the QR code, or they can save the number and, you know, like send a keyword, could be hi, could be, you know, a specific provider or community health volunteers name that then the person will now begin a conversation on Ask Nivi. Next. We also do outreaches. So under the PMAC project, with the partnership, like with IPAS, we've been able to conduct a number of, outreaches in schools, learning institutions within the target region, which is Nakuru County. That's where we do onboard, users to the Navy platform. Next. So we talked about provider. So once a provider, once a user has received a referral, they get an opportunity to start a conversation with the provider. So we have linked WhatsApp to WhatsApp. So what happens is, as you receive a referral as a user, this is how the referral looks like. So if you click on that icon, you will see chat with the provider. So the person, the potential customer, I say potential in this case because they could be having, they could be having additional questions before they reach out to, they actually take up the service. So we give them an opportunity to we make it easier for a person to take action by starting a conversation on WhatsApp with the providers. So we've worked with the providers, we've trained them on how to respond to questions or inquiries, and with the ultimate goal of converting the potential customer into actually a sale, or in this case, a service. Next. So under the PMAC project, basically, we started in March of last year. Yes, so we've been able to reach over, on a monthly basis. When we were starting, we, still figuring out the market, but on a monthly basis, we are able to reach over 3 million people through the meta ads that we do run. Next. This shows the number of referrals. This is both MA and FP referrals to the PMAC providers specifically on a monthly basis. So, there are insights from this data, but just looking at this, you can tell when users are seeking FP and seeking MA. So as we also do this, we are collecting insights that are very useful for decision making, not only for the providers, but also for the health system actors. Next. Yes, so basically that's the PMAC project. So what next from here? This is supposed to be Steve's slide, but I'm going to do it because of interest of time. So one of the things that we've been doing under the PMAC project is that business case, like showing value to the provider. What is, at the end of the day, NIVI is free to the end user, but it has to be sustained. There are cost elements that go into maintaining the platform. So we have to create that value to the provider so that they are able to actually see and at the end of the project be able to pay a subscription fee, which is a very modest fee. But yeah, we are very happy that we got an opportunity to try out, we've been under the PMAC project, it's been, we've had several phases of learning where we've done iteration based on the market, so the needs of the users, but also the needs of the providers. Yeah, and another thing is just scaling up Ask NIVI for education, awareness on SRH services and digital counseling. Yeah, so I just want you to have an opportunity to try out Ask NIVI. So you can save the Ask NIVI Kenya number and then send this word. This keyword basically will take you to the family planning journey, which we have other journeys, but under the PMAC project, our main objective is the contraception. So, yeah, thank you. We try as much as possible to get, with digital, like very convincing, eye-catching ads. So that's just one of the examples. Thank you. Biko? Okay, thank you.
Tumwangushie. Moja ya Vicky, and the other one for Steve. 1, 2, go. Ladies first. Then, who is second? For male before. Okay. For male before? Yes. Because of time, I will not go to Q&A because I know they are there, the Q&A. Why you decided to go to Nakuru County and not Isiolo. But it is 2, and I think we still have 4 o'clock tea. Yeah, we need to create space for the 4 o'clock tea. So basically, let's go for lunch quickly. If we can do 50 minutes, because it's already 2:10. Aha, there are no meal cards. Nihikona. Yes, it's just we're just going to go left and go. Yes, to the restaurant. Iko tu hapa street. So bon appetit, and let's go. So at least we can just do 50 minutes and then we come back for the interest of good after lunch. How was the lunch? Did we have bon appetit? Ama, this means it was okay. We are going to have Q&A after we have the chat bot. Now, this is a new name also. Hii haijaingia sana huko nje. This chat bot. It will need to go out there and Gen Zs waichukue. When they go out there, they tell us how this one works also. So we need to start the meeting for the afternoon session. So that at least we just try to catch up the time that we have. Our online members, I've been told there are a few who have not dropped out. Karibuni sana to the afternoon session. And I want to call upon RHNK to give us, we are at 1240, 1300 hours. Karibu.
Can we all stand up? Usually after lunch, there's a lot of things that happen. Huh? It was very hot. Now it's almost raining. Do you know this song? Concentration is the game. Concentration is the game. Concentration is the game. So you have to keep the rhythm. And if you fail, you'll do a very short dance of your choice, that is. So concentration is the game. Then I'll say Baker, Baker, Pamela, Pamela. Then Pamela will pass to someone else. Pamela, Pamela, Margaret, 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 Margaret. Right? Do you all understand the game? Okay. Let's do a rehearsal. Concentration is the game. Concentration is the game. Baker, Baker, Pam, Pam. So you understand the concept, right? Do you understand the concept? Okay, I'll start. Concentration is the game. Concentration is the game. Baker, Baker, Pam, Pam. You can't repeat the name. you can't try the name. So you have to do a short dance, then take a brief. You have to do a dance. Okay. But now you start. Keep the rhythm if you can. Keep the rhythm if you can. Thank you so much. We can have our seats. So you have to concentrate. That teaches you a lesson. The next time people are introducing themselves, don't forget their names. My name is Becca. I'm representing Reproductive Health Network Kenya. I don't know if the control room already have my slides. You can project them. So meanwhile, as the control room is trying to put their systems up here, I'm seeing beautifully there. So I want to take this scenario. Back then, when you're in the university, let's say you are in which university is around? I don't want to pick one in Nairobi. Which university did you go to? Daystar is. I want one that is uko ndani, Meru uko ndani. Wapi? Seku, yes. So you're a fresh year, your first year, you're coming in for the very first time. And you're sexually active, presume. You're 19 years old, I presume as well. But you want to go for family planning. Of course, the first choice. What do you do the first time you want to? Of course, I also presume that you know family planning. You'll know about contraception. And you want to go access contraception or family planning. Where's the first place you'll go to? Or let me make it simple. How do you access information on contraception or family planning? Assuming you're a first year, you know about SRHR, you've never been to, conferences, you've never been into such a luxurious setting or space. Where's your source of information about issues around family planning or contraception? Put yourself in the shoes of that young girl who just finished high school and is just joining any university for the very first time, but they're sexually active. Online? Where exactly online? Google. Yes, Google. Any other source of information? Friends? Pharmacy? Pharmacy? Yeah, Yes? University clinics, but do they really offer that information? Is it really readily available? Wait, okay, so you have been referred or you've gotten your information from Google, pharmacy, friends, and you go to the healthcare clinic at the university and they tell you that commodities are not available, or that's usually the case most of the time, or you're even looking for condom, you do not find it. What do you do next? What happens next? Well, let's say, okay, let me make it a little bit harder. You have been raped. And as a university student, you're in first year. Are you usually open to even discuss this kind of information with anyone? What comes to your mind the first time you're raped? What's the, okay, you know the right channel, but assuming you are very naive, what usually comes to you the first time? Keep quiet because of stigma? Yes. Go home, cry. But most of the time you're very stigmatized, right? You can't even talk about this information. But most of the time, if that happens, young people prefer to actually access this information online. They'll Google, they'll ask things like, I've been raped, what do I do? But do you think Google is actually going to provide you with information on what you're supposed to do when you're raped? It's there, but actually, if you want it contextualized to environment, I've been raped, Mary, what do I do? Right? So most of the time, we always assume that each and everyone actually have this information, but that's usually not the case. I'll start by actually introducing who RHNK is. Reproductive Health Network Kenya is a network of healthcare providers. We are in 43 counties. We have over 600 trained healthcare providers in 43 counties. And next slide, please. Sorry. So these are some of our strategic areas of focus. As I mentioned, we have a network of healthcare providers. Our major role is in service delivery. Our providers are trained to actually offer quality, comprehensive reproductive healthcare services. That includes family planning majorly. So in these 43 areas of counties, we have providers. So you'll say Meru, Nairobi, Kitui, Samburu, Kisumu, name it. So we have healthcare providers in those areas of focus, and actually that's where I'm majorly going to focus on. But other areas of focus also include advocacy, adolescents and the youth. We work a lot with young people, both in and out of school. We work a lot with youth advocates, or actually 69% of Kenya's population are actually young people. And as I've mentioned, one of the ways young people actually seek for information is through peer-to-peer, communication, right? And so we work a lot with the young people to cascade this information down to their peers. We also work a lot on research and evidence. We hold annual conferences per year. We also try to showcase this research. And also SRHR and gender equality at the workplace. And lastly, movement building. Next slide, please. So under our service delivery department, which is the major mandate that RHNK does, We have, like I mentioned, 620 healthcare providers, and our membership are drawn for different healthcare cadres. We have doctors, nurses, midwives, gynecologists that actually form that network. We have over 200 trained youth advocates. We work a lot around family planning, telemedicine, HIV services, and safe motherhood. And I'm going to talk about the telemedicine through our hotline, that is Nina Binti. So, next slide, please. Nina Binti was founded during the COVID-19, when COVID-19 was actually at its peak. Now, remember, we were told you are not supposed to stay outside past 7 p.m., right? So what happened during that time, if most of us can actually remember, is most of the healthcare services, they were crippling down. You cannot go to seek healthcare services. You cannot go to the doctor. You cannot go to the nurses. But does that actually mean that now people don't want the services anymore? Does it mean that people didn't want family planning by then? Actually, if you actually do your research, you'll realize that SGBV actually was on the rise at that particular time. There were a lot of people who actually needed a lot of, they're mentally drained. When the economy is actually depressed, there's a lot of mental illness that actually comes in place. And so that is when Nana Binti also came in place. And through that hotline, it's a toll-free hotline, patients or women and girls could actually just access that information. You call the number and we were able to actually refer you to healthcare services within your locality, or even if you just wanted to speak to a trained, a professional healthcare provider, you're able to actually speak to them through that hotline. They're able to actually give you services or even send medication to your locality. And it's easier for RHNK because now through the 43 counties that we were placed in, you can imagine in Samburu or someone who is in Isiolo, access to healthcare is not the same as someone who's actually in Nairobi. So this hotline actually came in handy during that period because we were able to refer healthcare. We were able to offer services and refer patients to our healthcare providers within this locality. Next slide, please. Yes, and so you can just see this is our hotline number. So we have both a WhatsApp where you can chat with a trained professional, and we also have a toll-free number that you can usually call, and it doesn't charge. So you're able to just call, and you're able to talk to a trained professional, and they're able to refer you. First of all, they listen to your case, and if it needs counseling, it's a trained counselor. They'll counsel you. If it's something about SGBV, it's rape. If it's rape, that is actually what I was asking about, the rape case. Then they're able to actually talk to you, counsel you, and offer you the right referral methods that you actually deserve. So after this, we always refer you to one of our healthcare providers, who we always ensure that before they join our membership, they're trained and they're qualified to be service providers. Next slide, please. Yeah, so the impact that we've had, so like I mentioned, Nana Binti hotline was launched during the COVID-19. And earlier on this year, we launched a call center. And this is because we realized that the number of people who actually call and try to access services from Nana Binti increased. So we had to establish a call center that is in Embakasi. And the beauty about Nana Binti is you never know who is on the other side. That's actually we're calling her Binti. We do not disclose who is on the other side of the call. And that means that your privacy, so the person who is calling is confident and is also it knows that the information that they're providing is going to be kept in confidential. It's going to be confidential and is only going to remain at the confidentiality of the service provider. So per day, RHNK has managed to reach a total of 80 to 100 calls. And especially, this always goes up when we have, when we host campaigns or like we have TV shows, this number usually goes up. And most of the time, actually, it's not even people calling in for services, but sometimes people just want psychosocial support. We're living in an era where mental illness is actually on the rise, and so we actually need somebody to talk to. Totally in 2024 so far, we have managed to reach 5,695 clients who have been referred for SRH services. and a total of 86,965 people who have reached RH&K through Nena Binti online. So majorly, Nena Binti is very, very good when it comes to awareness question for SRHR services, telecounseling services, and referrals to network of healthcare providers who actually form RH&K. That's my presentation. Thank you very much and welcome questions.
Thank you, thank you, thank you. That was brief. Nena na binti. Godano, kuja. Hawa, nataka utulize maswali. And because I'm interested in both, that's why I want to give you this mantle. We do a short Q&A. Karibu.
Good afternoon. So we'll be picking questions for both Ask Nivi and Nena Binti. Any questions? Fidelis, nikupe mic wa kwanza.
The first one, the one that was presented by Biko there. I wanted to know why you selected Nakuru County. What made you to go to Nakuru? Then your jina, Niniki, Nivi. Ilitoka wapi? Hii binti Nena na binti twajua huyo ni a lady. Then there was something else. No, first of all go to the other one. But those two, as I get the third one.
Anyone else?
Yeah, maybe I can ask a question to Nena Binti, that is RH&K. I can see your referrals for 2024 is around 6,000 or so. I just want you to confirm whether you are having any targets for the number that you are targeting to reach as referrals, and for these referrals, did they take any family planning method, or it was just referral? Sometimes you go and get reassured. Were there any family planning uptake for the same? And if so, which was the method that was highly considered by the clients?
So just a follow-up question to what has been asked about the referral system. Apart from knowing the methods that were mostly preferred, is there another way you have or mechanism that you have in place to measure impact in terms of other than just referring? What else which other indicator do you use to measure your impact for the Ask Nivi program?
Great, thank you. I think I can start with hers. Yes, the other indicators we actually put in place. So what I actually showed was basically a high level of the impact, the number of people we've reached so far. But we also try to figure out what is the locality, like where are we getting most calls from, and what is the age, which age group actually are trying to seek most services from. And like I mentioned earlier, is that young people actually are the ones that are coming in for most of these services. And I mean, just to couple up with the question that was asked earlier on, yes, we do have a target. We have a target for the number of clients that we want to refer. And we also, I mentioned earlier on that we referred 5,695 clients for services. And these are clients who came into different facilities and did uptake services. And the most, some of the methods that are actually coming up are implants and injectables. Those are some of the methods that most of these people are actually going for. And so yes, we do have a target. That is a target. And just beyond that, we also have social media platforms. We do have a Facebook handle, we have Twitter, we have TikTok, we have Instagram, X. We have those handles where our clients are also just able to come back and give us feedback based on the service provider. Did you actually get the service that you went for? And were you able to get the commodity? How was the environment? Was it clean? Such kind of things are actually things that clients always give us a bit of feedback on the same, because we also want to retain these clients and also maintain the trust between the service provider and the clients. I think I've exhausted mine. Thank you.
Okay, so let me go to the history of Ask Nivi. Actually, our founders used to work for Population Council here in Kenya, and they worked in different other regions where Population Council is. And it started way back in 2016 for family planning, only not even demand generation, but like uptake of family planning services in Kakamega County. Kakamega, and then after that, they took a pause and went to India, and they did a lot of work in India. So Ask Nivi is in Kenya, India, and Nigeria. We have major projects in India and Nigeria, and a few projects in Kenya. It is available all over the country. Like if you have access to WhatsApp, we currently have Ask Nivi in 8 languages, but in Kenya it's only English and Kiswahili. Yeah, we are hoping that, you know, like with AI and advancement of technology, we'll be able to switch to other languages without the heavy investment of translation. So there was a question around how we measure impact. So we talked about behavioral science, using behavioral science to actually nudge people to take up service, but also it's to do with change of behavior. So we have within the several the journeys that we have within the chatbot. I'll give an example of the family planning journey. When someone gets into the family planning journey, we ask what are you here for today? You want to learn about methods available for you, or you want to get a referral, or you're just, you know, like you want to learn other things. So let's say you want to learn about a method, and you've gotten to a point of referral after you've been educated. We detect intent and measure level of readiness. So we'll ask you, are you ready now to take up a service? And if you say no, we'll ask you, why are you not ready to take up a service? So when you answer the question of readiness, you're taken into a barrier coaching conversation. So let's say I am not ready because I don't have the money to go for, to take up the service. We take you into a conversation where we tell you these are, you know, like if it's FP, it's free in this, you know, like we have government facilities that are offering family planning for free. And then if you say that you have issues with myths and misconceptions, we'll take you through a conversation to, you know, like to educate you on the different methods, but also be able to demystify the myths and misconceptions around family planning. If you say family or social pressure, we'll take you through that conversation also. And then at the end of that conversation, we ask you, are you now ready to take up a service? And if you say yes, then we will give you a referral. If you say no, we'll check on you. We'll check on you after a number of days to nudge you, to ask you if there's if you need more information, or like if you're ready. So we do test level of readiness. So because we have to measure when you talk about awareness or knowledge for the population, that's one way of being able to tell that this person entered this journey and didn't know this information, or like wasn't ready to take up a service, but now they have moved to a level of readiness where they've actually taken action to visit a provider. And when they visit a provider, 3 days after you receive a referral, you get a nudge. This nudge is asking you, the objective of this nudge is first to confirm if you took up the service. If you did take up the service, we ask you about the quality of the service that you received from the provider. If you didn't take up the service, we'll ask you, the reasons why. And if it's because of, like a number of barriers, we take you again through the barrier coaching conversation. And then we also have quizzes. So as the person enters the journey, like for HPV, how much information do you know about HPV? So we have content in form of quizzes. So like 5 questions where we test your knowledge, and at the end of the quiz, we are able to give you a score. So that's at contact. And then after contact, we will, again, after the first contact, we take you through the same conversation and be able to test if you've been able to learn, like gain knowledge on like HPV. And then we are able to measure that also. So that's just what we can do, or like how we can measure impact within the chatbot. But then definitely we have different projects that we work with that have its own KPIs for measuring impact. And it's also important to say that we do refer to Nena na Binti. So yeah, we work with several other providers or actors within the SRH space. Yes. Thank you. I don't know if I've answered. The one for Nakuru it's him to answer.
Original.
So what did Ben tell me about? Oh, so Ben is our co-founder. First ilianza kama mpango na panga uzazi, and then like family planning, panga uzazi, and then it moved to, I think, when some of the words that really used to come out when they were going to the field, they were, like PhD researchers for Pop Council, and it was ni vipi ni hivi, like ni vipi ni hivi. So yeah, that's Nivi. Yeah. Thank you.
Ni hivi. So ni Nivi. All right. So why Nakuru? The project has evolved. I think from my presentation, we started in 2018. By then, the challenge was unmet need for contraception, leading to high rates of unintended pregnancy. In fact, Nakuru was second to Narok then in terms of unintended pregnancy rates. The rate of abortion there was also quite high, with almost 30% of women, abortion rate actually. So the intention then was to support provision of contraception following an abortion, so that women and girls could be able to manage their fertility and space kids as per their fertility desires. But then as the project evolved, we realized we could actually develop more interventions to scale up contraceptive use within the county, and see how we can use those learnings to support scale up outside Nakuru County. So we transitioned from not only focusing on post-abortion contraception to just contraception in general, but also supporting the needs of women and girls who intend to use contraception after termination of pregnancy. So that's why Nakuru was desired for the project, but we've since expanded to additional counties like Kericho, and we also have presence in Western Kenya as well. Yeah, thank you. Sorry? Oh, Isiolo. Isiolo should be our next one, but also given modern contraceptive prevalence rate, we're also guided by that. So we are hoping we can set our feet on West Pokot, which has high challenges in terms of unmet need for contraception. Isiolo equally, and maybe Garissa as well. Thank you. Okay. Fifteen to 49, women of reproductive age.
I think in the presentation she said 18 to 40. That I wanted to ask,
Mhm.
do you have data of, especially on the under 18s, do you have any data of girls or even under people under the age of 18
Mhm.
requesting for these services, and how do you go about that? That
Ah.
was going to be my question.
Okay, so we have data in two categories. So there is a married adolescent, which their contraceptive seeking behavior is okay. They can also consent on their own because they've assumed adult responsibility. But for adolescents who are not married, the general behavior we see most of the time is they'll come accompanied by a parent who will consent on their own behalf. And in most cases, the decision to use contraceptive is not driven by the adolescent, but by the parent in order to contain unintended pregnancy, rather. Yeah. But it's quite low compared to the general population.
When I talked about 18 to 40, those are the, like based on the data that we have, those are the people who interact a lot with the chatbot. Like that's the population that, yeah.
With that clarification, I need it. You have a question there?
Thank you. I was just following up. I tried asking Nivi, and I saw that it is more of a structured Q&A. I was just wondering, because I tried typing a text inside, and it told me that it is an automated system. So I was wondering if you could, without heavy investment, allow a more interactive interface that allows the user to type a question or to record an audio in the accommodated languages. Because as it is now, I have to like keenly follow a yes or no until I find something relevant, which is a little difficult.
Feedback.
Yeah, so on that point, actually, if you realize that you can onboard at a go. So onboarding is, you know, like we are taking a conservative approach to implementation of AI. Reason being, I don't know if you've seen studies by WHO that when it comes to health, you know, like AI was throwing questions that, or like responses that were not, I would say, were not the appropriate answers. So health is a very restricted and also very sensitive area. What would be the difference between us and Google, for example, or ChatGPT, if we don't give verified information? Another thing that is kind of like guiding us to taking the conservative approach is the fact that for most of the projects that we have to actually hand in the data source for our data. So our data source is normally WHO and then the local government guidelines. So like for Kenya, it will be the MOH guidelines. Not to say we are not doing it. We haven't done it in the Kenyan market. Like I said, Kenya is one of the places, like Nigeria and India have become our test beds because of, I would say, availability of funding to do that in those environments, but whatever is being done there will then be transferred to Kenya. And then like right now, we're just, we're still collecting data, like we're collecting information for teaching the, you know, like programming the AI so that we do not get ourselves into situations where we give misguiding information. So we are taking a, you know, conservative approach to that. Yeah.
Yeah, maybe to add, we are operating in an ecosystem, and we also recognize the other players who are also supporting our effort. Like I think presentation from RHNK, they have a Nena na Binti where you can provide, you can share your problems or need, and then they can be able to sort it out. There is also Nimechanuka platform where you can text, express yourself there, and be connected to a counselor who will be able to help you out. Yeah, but for NIVI, the content there was also developed based on the frequently asked questions around SRH, contraception, access to post-abortion contraception, and all that. So they've been put together based on that, and I think as Jackie mentioned, is from something that has been researched to be more responsive to evolving needs of women and girls. But we also understand it cannot solve 100% of the issues, so that's why we collaborate with NIVI, such that any need that cannot be addressed by the platform, then we just refer to NIVI, Nena na Binti, where they'll be able to get to speak to somebody and be able to get more personalized kind of support. Thank you.
Yeah, so sorry. So that's why, like, in the meantime, what we do is we give you an opportunity to chat with the provider so that you have your, and then they're like, you can get as many as 10 referrals at a go. So you get the first 3 based on your location, and then have an option of, getting more if you want. So one of the things that we do is during onboarding, we'll ask you about your location. The reason we ask for your location is we would want to give you referrals to a provider who's within your location. That is to bridge the barrier of distance, because distance is one of the barriers when it comes to service uptake. People don't want to pay more to travel to get service here. So that's the reason why. And even within the chatbot, they're actually virtual resources. Nena na Binti is one of the virtual resources that we do refer users to. Thank you.
Actually, mine is for us to brainstorm on, actually, as we just think through it. Again, I think I really like that question. Not to put in the spot, but I love the fact that large language models, and by large language models, I'm referring to models such as ChatGPT, they're able to keep evolving. The information that we have or that I collect, I'm able to fine-tune my data furthermore to actually give more structured and more refined languages, more refined responses. Because I know the accuracy might not be 100% of the models, but I think even ChatGPT is continuously refining the information to give better responses. And I find it to be quite user-friendly in the sense that I'm not restricted in the questions that I'm supposed to ask. So my question per se was, the data that you get, does it usually find its way back to that model to fine-tune it? That's one. And 2, how do you deal with things such as consent? If I have a minor actually coming in to seek information, how do you deal with, and I'm not putting in the spot per se, I'm just trying to understand how that actually works. And yes, yeah, exactly. Thank you.
Yeah, so if you go to the platform and you say we ask you your age, we cannot allow you to start a conversation with NIVI if you're not above 18 years. That is because of regulatory issues. And then maybe I should be mentioning that we are part of the OpenAI Accelerator program. So right now we are actually, using our data to craft the AI piece that we would want to deploy within our chatbot. So it's just that, there's just a lot that is happening. I think, like if you follow our LinkedIn, you will see that we are part of it, and it's unfortunate that Kenya is normally, when it comes to our projects, Kenya is normally the last one to receive what has been done in other countries. But yeah, there's a lot happening in Nigeria and India, and it's because the programs there are larger, like they are Gavi funded, USAID funded. Again, funding is the thing. Yeah.
Thank you. Any other question? Going once, going twice. Fidelis, I can invite you back to the kwa jukwaa. Thank you.
As you can see. Na Gen Z tafadhali usiwe na ka hashtag ya somebody must go. Is your hashtag somebody must go?
I can neither confirm nor deny. Tafadhali asanteni sana kwa kupiga Gen Z picha. Kama ni masani na haribu. Mungu ni mwema. Please follow ICPD Youth Coalition on all social media pages. Shameless plug. Thank you.
Thank you so much. Thank you so much. The other day we had a meeting and we invited somebody, a Gen Z. And that Gen Z was a real Gen Z. Yule alipigwa picha kama amefanya hivi. Yule aliambia cop, push me, push me. Her hashtag was somebody must go. Back is this. Here is our DG listening to somebody saying somebody must go. So we really had to do a lot of, that is Awaina, the office of Kavota. They had to do a lot of kuzimamoto the whole night. That post was put at 11. It was put during the day, like today meeting. By the time tuligundua it was at night, I think. So night ni kuzima moto. Telling her, please, just remove that one, put another hashtag, then urudishe kwako. Ama toa hiyo tu, uweke ingine. We worked mpaka midnight. Then she decided to remove, but now posted at 11. Damage was 11 a.m. So damage was already done. So Gen Z is, we are not for mass, somebody must go. So basically, thank you very much, Godano, for taking that particular session on Q&A. And I think that is what people are looking for, to get this new digital technology and innovations that we have put in place to help our people, especially in this SRH arena. And we are very happy for that, because with that, it saves a life, it saves somebody not bringing a child here that they did not want, because we know of the other repercussions. In addition, we really stop not unwanted, unintended pregnancies. So basically, that was nice. And I hope we have joined the WhatsApp page. We can also roll it out to other people, Sindio? Yeah, we can also roll it out, and I think that is what we shall do as time goes on.
Yeah, okay. By the way, we had somebody online who is a person living with disability, or a person with disability actually, and he wanted to know how you are reaching out to such people, the PWDs, with regard to Ask Nivi and Nena na Binti. Are you inclusive in those chatbots?
Respond to that. Actually, the question was asked online by one of our listeners, was Joseph Baraza, community engagement by actively involving deaf organizations and communities in outreach and education efforts to raise awareness of reproductive health and rights. So we need to know whether we have left them behind.
Yeah, not really. We are very much inclusive, actually. Part of our youth, we have persons with disability representative, and they are always referring. You know, when we have outreaches, when we have in-reaches, they refer the persons with disabilities to come and seek the services from our static clinic or to any of the healthcare providers within those 43 counties that I mentioned earlier on. And through Nena Nabinti as well, they're able to call and still get the services and still get to refer to any healthcare provider within their locality to seek the services from. So yes, so very much inclusive, and we're always, in our programming, we always ensure that the persons with disabilities are represented as required. Thank you.
Yeah, so for us, for the chatbot, provided you're able to read, because it's like if you can use WhatsApp, you should be able, if you can use WhatsApp, really, just WhatsApp, your normal WhatsApp for communication, you should be able to use Ask Nivi, because it's just like your normal WhatsApp. And also, we are normally embedded within projects, so larger projects like the PMAC project, but then again, like it's still available, like even outside the PMAC project, it's available, provided you have access to, you've discovered where Nivi is. Like you've heard of Nivi today. If you Google Nivi, you will be taken to a website, and from the website you can click on a link that redirects you to WhatsApp. And yeah, thank you.
Yes, thank you very much for making those provisions for our fellow citizens who are abled differently. We are almost getting to the tail end, and we don't want to close anybody in or yes, out, because we are already in. Thank you, Carol. Yes, we don't want to close anybody out. Anybody with a burning? I know I have a burning with a char there. And lakini ni nyuma ya tent. Margaret, I'm almost getting you on board so that you can give us a way forward. Then we go to a small closing session, and then we call it a day. And we're also buying times that the food can be digested and make use of those cups out there. Margaret, tafadhali kuja utupatie way forward.
Way forward ni nyingi. Aya, good afternoon. Good afternoon again. Or at least bado niko na sauti for recording. So anyway, now we are coming to the tail end of this very interesting day. I hope you also enjoyed yourselves. Kuna yule mtu alishinda hapa kama ameboeka? Anybody? Hata wengine wamepata biashara. I can see Achar really smiling. Yeah, ameshapata my business clients. So it's for me it's been very interesting. And now I would like us to look at the way forward. And the way forward for us as NCPD and working in the space of, NCPD working in the space of ICPD. We are saying the world is digital. Considering that, according to the UN, already 5.6 billion people globally are actually digital. The ones who are not, we have only 2.6 billion. And we can say most of the time we can blame issues of inequality, issues of poverty, causing that in access. Why I'm saying that, we have data that shows that 79% of women in low-income countries are not using the internet. So we need to work. Already I'm doing way forward, and that is already a gap that I'm pushing up. The issue of inequality globally, it is actually sticking out, and countries are being urged to do something about it so that we have an equal world. When we are talking about digital, we are not leaving anyone behind. Yes, so the future is digital. Because digital technologies are able to empower communities, we can enhance women's financial control. You know, like things like M-Pesa, sindio? We all know about M-Pesa. And a lot of women here in Kenya, I can attest, although without true research. If I searched, hii kitu imekufa, ama mimi ndio nimesonga. If I would do some research, I will find the data. It's just that I've not had time to check it out. But I can attest that a lot of women in business have really gone up because of use of digital platforms like M-Pesa. There's a time I heard somebody talk of how they were actually doing business using M-Pesa. They borrow money, M-Shwari, in the morning. They go to the market. They buy their goods. They come and sell. And by evening, they're able to repay the M-Shwari and make some profit. Ingine wanaeka kwa chama. And the rest they use, ama they save elsewhere. And they have been able to rise that way. So digital platforms have enabled them to do that. Then we have the online education platforms. If you scan around, I'm sure you will find out, since COVID-19 happened, a lot of institutions of higher learning went digital to continue higher learning, higher education. The lessons didn't stop. And most of them have continued in that direction. And so we have been able, using the digital platforms, been able to continually provide educational services to those who need them. Then, of course, Kivaya in the morning talked about government services. So we are aware there is that aspect. Today we have missed out a very important platform, that is early warning systems. Because the person we had engaged to do that was not able to join. But I'm sure in the near future, as we continue celebrating ICPD 30, we might be able at some point to bring him on board so that they are able to make that presentation and create that kind of awareness on climate change and adaptation. Yes, so our message today from the digital world, future-proofing ICPD, we are saying we are actually banking on STI, science, technology, and innovation, to future-proof ICPD. And now this is the recommendations that we have, that we need a lot of teamwork from government, from private sector, from civil society, from communities, from everybody, including religious leaders, academia, kila mtu. We need to increase knowledge we need to sensitize our communities about digital solutions that are available so that they are able to plug in. And with this, of course, we all know here, I'm sure, that STI is the way to go if we are talking about development. We will not develop if we are lagging behind in STI. So we need to upscale that aspect. Then we need strategic investments in infrastructure, that is digital infrastructure. I know there is a strategic plan for ICT that has been approved, but I know the funding has not been sufficient. But anyway, I think Kivaya in the morning when he was making his presentation mentioned some of those things that need to happen, like the kiosks, I don't know what, fiber optic cables and all that. So they need to be enhanced and well distributed across the country. So we need investments also for digital literacy. This one for Kenya, we are still quite low. We need to pull up our socks and gloves. Then also invest in information availability. So that is why we are talking about science and research, so that we are getting evidence that we can push through to our communities. Then we need to develop standard operating procedures. For example, I know AI is the best thing that could ever happen in terms of bringing efficiency and effectiveness in delivery of services and knowledge. But right now, how many people are using AI to do anything? Hapa kwa hii room. Ninaangalia uso, ninaona ni majenzi tu. Old school kama mimi, bado sisi we are treating it with a lot of caution. Uber? Yes, Uber I use, but sijui vile hata imetengenezwa. If you ask me, I just know that I have the app on my phone. I can call and get transport. But how it has ever been done, I have no idea. So that is what I'm looking at. The issues of coding, I understand, very critical. Then we need to also look into the issue of improving the legal frameworks that are around the ethical and equity issues in terms of digital solutions. And I think that is all I have for you. Is there anything else? Yeah, so thank you very much. I give it back to our very able moderator.
Thank you, Mwaila. Mwaila ametupatia way forward with that is called recommendation like. Wacha tumudropie, wacha anguke nayo. And you've talked about AI. I went somewhere and my friend was with her son who is in grade 5. Akona laptop somewhere we went. Within 2 minutes, homework was done. Within 10 minutes, akaenda hivi, akarudi, kijana namwambia nimemaliza. He was to craft 150 questions on nutrition. Alienda kwa artificial intelligence, akaiambia ifanye hivyo. Ikafanya hivyo. Sasa, ukiona sisi old school, tukiogopa hiyo kitu, ni kwa sababu CBC, there will be robots. So hiyo kitu hatuguzi. Within 2 minutes, the boy anaulizwa akaneti nimemaliza. Ana hata hatajui kuficha, unaona? Sisi tungeficha hivi, tuseme I'm in question 10, I'm remaining 140. CBC ilisema tu kuangalia questions Even her, she didn't know some of the answers. Because ni AI imefanya. So that artificial intelligence is just like the way we said in the morning. It has the do's and the don'ts, and then also, if we really encourage our children to do that, then they'll stop thinking. Inaitwa cognitive. Huku juu. Now that one we rewrote in the name of digital world. Yes, in the name of digital world. So again, we need to take it all with a pinch of salt at least. You crammed CBC, unajua we are no longer cramming. So as we crammed, and so now we want to see whether this CBC, they stop cramming, like what there was in the 844 system. So as we embrace digital technology, like what Mwaila has said, in ICPD, we can really use the digital world to ensure that people access information as services as well, and that will be very good. So I want to enter into the closing ceremony, and before that, I want to take this podium now and push a vote of thanks to our able partners who joined us from yesterday. I think Mwaila has been on overdrive to have this particular policy brief on a digital world future-proofing the ICPD supported, and at least it has brought in fruits. PS Kenya, thank you very much. These are the partners that have really supported us. PS Kenya, IPAS, Girl Effect, RHNK, and UNFPA. You've made our stay here very comfortable, and we are very, very grateful. Na Mungu awabariki sana, sana, sana. Not forgetting this Waridi, which has been paid by IPAS, and we are very, very grateful for that, and providing the space and the time for us to be here. Even for our online team, Ken, I know you've been with us all the way since morning. Mukiwa na Lubanga, thank you very much for joining us, and also for those who really joined us in the morning, and then for one reason or another they pulled out. So I want to have a short closing ceremony, and I want to call those who did not talk to us in the morning. Eunice, Girl Effect. Let us see about the effect of girls. Karibu, kuja. Come and give us some remarks. Government meeting has to be opened and closed.
Good evening. Yeah, it's my pleasure to be here in this very important platform. Yeah, the future is actually digital, and I'm glad to be part of this great team that is moving, driving the world forward through digital platform. So my name is Eunice Motisia. I'm representing Girl Effect, and Girl Effect is focused on driving behavior change in relation to sexual reproductive health through digital platform. We are mostly known as the Wazi people. We have a platform, a WhatsApp chatbot called Wazi. So if you log in there, you'll see the content in there. So you're trying to reach the young people through that digital platform. And that is backed up by reinforcer channels like YouTube. We have also the podcast and stuff, so that we are able to give a variety of options to the young people. The young people are the leaders of now. Before we used to say they are leaders of tomorrow, but they are also leaders now. So engaging them and involving them in the process is critical, yeah? So that we develop or we design platform, messages, and everything else with them so that we are relevant, yes, and addressing the emerging issues. What we faced when we were younger, before we were 30s, yeah, those of us who are above, it's very different from what the team or the young people are experiencing now. Why? The world has changed. So let's work with the young people to develop messages and platforms that are relevant to them now and moving forward. So human-centered design is critical. And Girl Effect embraces human-centered design, and I know most of our partners are. So let's work with the young people to develop relevant, current messages and media that they can utilize and be informed. And most importantly, the impact. We measure impact. If it is not documented, it never happened. Yes, so the questions that were coming up in this platform, I listened and it was more of, okay, so, yeah, they were referred, yes, so, yeah, did we see a change in, uptake of services? Did we see a change in behavior? Did we see a change in, So as we work on the digital platform, we have at the back of our minds, how are we measuring our impact through, the digital platform as well? We are digital, so we also have that in the process as we go through. Otherwise, thank you very much. I really appreciate each partner who is here. And NCPD, congratulations for taking us this far. And we hope to move to greater heights on this. Thank you.
Thank you very much, Eunice. One, two, go. So thank you very much for that. And that is quite good on what we are doing with our young people, making them to have positive vibe as far as digital world is concerned. I was asked by somebody, there was a time, I have not gone to TikTok myself, by the way, because I had the things that are done at midnight. Nikaogopa kwenda huko, but I understand they were gagged. Zilifungwa. Hizo walikuwa wanasema ni lions, doing the king, I don't know the elephant, I don't know the monkey. Those things, I understand they were closed or something. So sasa ile nilisikia vile what happens huko TikTok, nikasema pana, wacha moto kwanza ifanye nini? Cool off. Sitaki kwenda huko kunini. When we were disseminating the population policy, that was July, mid-July. It was at the heat of the Gen Z's protests. And I remember the one they entered in Parliament. We were with Mwaila in Samburu. The county commissioner almost said this, you are not going to have the meeting. And apparently our meeting had Gen Z's. But tukamwambia wewe kuja ufungue mkutano. The Gen Z's in the room are okay. They are okay. So by afternoon hivi, tukaanza kusikia vuvuzela huko. Tukasikia hizo. Then again, we just told the vehicles za gavazi ingie ndani ya hotel. Then tukakaa hivyo, tukakuwa in the same dress now with the Gen Z's. And the whole of that week, I think for 2 weeks, we were having the disseminations. And one thing that, and they were really vocal in those meetings. And one thing they were telling us at wanaogopa, Mungu, ujimoto ni ujimoto, na kuoa, na kuolewa. Yes, actually they are fearing that too much. But hiyo ya kuolewa na kuoa na watoto, niliwaambia hiyo achieni. Sio wewe unataka, kikitu kitakuja kitakuitisha. Uko ndani, you will not understand what happens. So basically, our Gen Zs, as they go on, I told them there is no way you're going to break the family tree. You have to bring up, mulizaliwa, lazima muzae hata kama ni kamoja. Muzatazadu kamoja, kaendelee na maisha. So basically, we are here and you're with the Gen Zs, and we need to know that we need to have positive vibes when it comes to the digital world. I want to call Anne, PS Kenya, to close for us the meeting. Karibu.
How are you? It's evening. It's a pleasure to me. It's my first time coming for this meeting. Actually, I was told to come and stand in for my CEO, Dr. Margaret. And I'm honored to be part of this forum today, which has been very interactive and very educative to me. And personally, I'm grateful on behalf of PS Kenya. We are really grateful being part of the ICPD. Actually, we were implementing a program by the name Accelerate that was birthed from the ICPD 25. And our 3 goals are reduction of the maternal mortality, unmet need for family planning, and reduction of harmful traditional practices, as well as GBV. So we are well incorporated in the ICPD 25, coming to ICPD 30. So on behalf of everyone, we want to say thank you for the NCPD team, for the other stakeholders, the CSOs. We are really grateful having this forum all together and sharing, putting on our learnings, our ideas, and as well as the interactions we have had during our break times. So tunashukuru sana, and God bless all of us. Yes.
Thank you very much. When the meeting is closed, it's closed. Nataka tujiklapie 3 factorial bottom up. Bottom. So if it is bottom up, it is 3, 2, 1. Mama boga ako juu, mtu wa bodaboda ako juu. Decision makers wako wapi? Wako chini. Warm up for that job well done today. Warm up. 1, 2, go. Yes, thank you very much. And I want to request this gentleman, I haven't heard you talk. Tupeleke juu mbinguni. Closing prayer.
Okay, habari ya jioni everyone. Kwa majina naitwa Felix Otieno Cage. Niko na media. It's been a good day. It's been a great day. Tunashukuru Mungu tumefika hapa. So at this point I'd ask us to bow our heads as we pray. So Father Lord, we come before you this evening. We thank you for being with us throughout the day. We thank you for this forum, and we pray that all that we have gathered here, the knowledge, that we'll put them into use. And as we head home, also be with us, guide us, be with our families, and I also pray for our country, Kenya. In Jesus' name, I pray and believe.
Amen. There's a